Wonderful. So as you just heard, we are recording this webinar, this workshop, and we will make it available after the fact on the CUSP website. And I would also like you to please follow our housekeeping rules. So during the presentations, we ask you to kindly keep yourselves muted, keep your screen, your video off, so we can follow the speakers. But after each block, we will have time, we will have quite a lot of time for questions and discussion. And so you're very much welcome to put your questions or your comments in the chat while you're following the talks. And we will get to as many questions as we can after each session. Also, please rename yourself in Zoom following our convention here, just your first name and your last name. And if you like, you can also add your affiliation, like I have done here. And yeah, with that, we would like to get to you. We would like to know who you are. And we've prepared a little Zoom poll. So maybe I just stop sharing my screen so we can launch the poll. Please feel free to answer the questions in the Zoom poll that we get to know who you are. Want to know if you're part of the CUSP cluster or if you're joining us from outside. Great, first answers are coming in. Quite a few non-CUSP members joining us today. That's great. And then, of course, we're also interested in knowing which stakeholder group you're part of, because obviously the work we do is transdisciplinary, not only interdisciplinary. So we need different perspectives to deal with this question. Excellent. So I'll give it a few more seconds for you to answer as you're joining us this morning. Okay, I think, Stefan, maybe can we leave the poll open as we move forward?
Yes, for sure.
Great.
Yeah.
So maybe we just leave it open for a little longer and keep going. And I will now gladly hand over to my colleague. Stefan Foss Hansen is Associate Professor at the Technical University of Denmark. And Stefan has a PhD in Environmental Engineering and also a Doctor of Technology. His master's degree is in Technology and Socioeconomic Planning, and he also has a degree in Environmental Law. So Stefan has a really interdisciplinary background, which equips him very well for working with regulation and risk assessment of materials and emerging technologies. And I've been working with Steph for a while now, and I can really assure you he loves the science policy interface. And so we are in good hands. Stefan, over to you. Please set us up for this workshop today.
Yes, thank you very much for the nice introduction, Jane. It's very nice of you, kind words. So basically, the question I would like to address, and we would like to address during this workshop, is what are the answers that we need to address from a policy regulatory standpoint when it comes to risk assessment of nano and microplastics. There's no doubt that it's an emerging issue. We're all concerned about it, but when it comes to regulation, it sometimes can be tricky to really understand what is it that we need to provide as researchers, as scientists, so that it's the most meaningful data and information for policymakers. And that's kind of the inspiration for this workshop. So what we have done today is we've invited representatives from various regulatory authorities in the EU and also globally to come to us and present what do they think are the state of the art within science policy and what are the most important questions that they need answers to. And then, of course, we hope that we as part of the CUSP can address those knowledge gaps so that the work that we do become as meaningful and as useful for regulators as possible. So that's kind of the essence of this workshop.
Great, wonderful, Stefan. Thank you so much. So let's take a quick look at our agenda for this morning. We have 3 sessions prepared for you, and I would say we start right with the first session, which will be on the policy updates, and we have 2 fantastic speakers invited. Well, actually, we have 3 fantastic speakers, and we have a 4th fantastic commentator, I want to say. So first, we will hear from the colleagues at DG Environment at the European Commission, Valentina Bertato and Andrei Kobe, who will walk us through what the Commission is currently doing in terms of micro and nanoplastics. After that, we hear from Tobias Nielsen from the European Environment Agency. After those 2 sessions, we will hear from Birgit Sokol-Klütgen from the Joint Research Center, also part of the European Commission, who will share some comments and reflections. And we will present each of those talks individually to you. And following these 3 interventions, we then have time for Q&A and discussion. And as I said already, please collect your questions, share your comments with us in the chat, and we will try to get as many as those as possible. And now I would like to hand over to Stefan to introduce our first presenters. And Stefan, you are still muted. It's always tricky with.
Yes. Valentina and Andrei Kobe are both policy officers at DG Environment. They have a long background in working with regulatory issues such as nanomaterials and microplastics, and therefore we are very pleased to have them here and present what the Commission is currently doing in regards to those specific areas and where they overlap. Please.
Thank you. Good morning, everybody. Thank you, Jane and Stefan, for the nice introduction. So as anticipated in this presentation, we will cover what we are currently doing from a regulatory point of view for microplastic and nanoplastics, and what we plan to do and what are the research needs. So next slide, please. So an overview of the presentation, I will present the first 2 points on the policies to address the concern of microplastic pollution and what we are currently doing, the actions from a regulatory standpoint and the status. While Andrei will go more in detail on the gaps, the science gaps we have in order to support better our EU policy, and then the policy needs. So next one, please. Just a quick introduction on the broader policy framework. All the actions I'm going to present are within the European Green Deal. More specifically, the action concerning the zero pollution ambition for a toxic-free environment, which is the basis for our chemical strategy for sustainability and also for the zero pollution action plans that they both set ambitious objectives concerning microplastics. Next one, please. So we have a major objective of preventing the pollution. So this should be the first action we take, because once the pollution is there, it is, especially for microplastic, it's very difficult to remediate. But then we have also actions and legislative frameworks to try to minimize the pollution and control it when it's inevitable. So looking first at prevention, the main action we are currently taking, and I would say one of the most advanced concerning microplastics, is the REACH restriction on intentionally added microplastics, which is mentioned both in the plastic strategy and was repeated also in the circular economy action plan. And then a second one, maybe even more important if you look at the volumes, is to reduce the unintentional release of microplastics. When we get into the minimization and control, you will see in the rest of my presentation, we have a series of legislations we can use, but the actions on microplastics are underpinning the Zero Pollution Action Plan, where we have clear targets to reduce, for example, plastic litter in the sea by 50% by 2030, and specifically on microplastics to limit the releases into the environment by 30% by 2030. And indeed, the first two actions on intentionally added microplastics and the unintentional one, their aim is to reach this target of a 30% reduction. Then going to other maybe more general actions on plastic in the plastic strategy and in the circular action plan, we have general objectives to reduce the littering, to increase recycling, especially for packaging. We have the review of the packaging legislation ongoing. And then very important for this discussion today, we have a clear objective to close the data gaps for the scientific knowledge, especially in relation to the risk for the presence of microplastics in the environment, in drinking water and in food. Next one, please. So what are the regulatory frameworks that are relevant for our work on microplastics? We have the chemical legislation, REACH. So this is the area I know better because I work on REACH restrictions. Then we have many other legislations that can be used, and they are mostly product-specific ones. For example, tire labeling.
Okay, so I can't hear Valentina anymore. Andre, are you here? Do you want to jump in?
Yeah, just a second. I hope you can hear me. Yeah.
Yes, we can hear you. I hope Valentina's okay, but something went wrong with her internet connection.
Yeah, I see. Okay, so good morning. I'll try to jump in, and hopefully Valentina can rejoin and pick up on the few remaining slides that were on her side. So first, also thanks for the introduction in the beginning, Stefan. I work with Valentina in the same sustainable chemicals unit in the environment, and while I'm not dealing so closely with microplastic as term, I do work on REACH generally. And as introduced, I'm also working on nanomaterials, and through that there is an overlap with the nanoplastics, which we are on which just immediately to start doing some promotion. We are in these days. I was hoping today, but I haven't received a link yet. We are actually publishing as well nanoplastics state of play risk on risk. Let me explicitly tell you to suspend some to create some suspense. Nanoplastics state of knowledge and environmental and human health impacts. It's a science for environmental policy brief, which future brief, which should kind of help also provide maybe some information on what we from our side understand as current knowledge, particularly in terms of nanoplastics. But of course, it links to the general policy of microplastics, and hopefully within the next days and before your next CUSP workshop, there will be this information also available.
Great, Andre. Thank you so much. I see Valentina is back. So I suggest we go back to her after hearing your little advertisement, and we'll come back to you again when Valentina is finished. Is that okay?
Okay. I hope that it was more smooth than it felt, but yes, I appreciate that. Please go ahead.
Perfect. Thanks. See you in a sec. Valentina.
Yes, I'm back. I lost connection. I don't know what happened, but okay.
No worries.
So I was speaking about the water legislation, then we have the food contaminants regulation. I will say something about this later. And then maybe just to mention that we have also a lot of activity at international level. We have discussions ongoing and negotiations for a new treaty with the objective to end plastic pollution. It should be an internationally binding treaty, and the preamble to the decision that that prepared the ground for the treaty is that the plastic pollution includes microplastics. So we see also a movement internationally. So next one, please. So the first action, and as I said, this is the one that I know more about, is the REACH restriction. We cover all the microplastics that are intentionally used, and the actions concern a ban for those emissions that cannot be reduced in another way. But for the emissions that can be controlled, we have foreseen in the restriction reporting by companies using microplastics and instruction for use and disposal to reduce the emissions. What is the status of this? It was a very long process with a restriction dossier prepared by ECHA, an opinion from the ECHA scientific committees, but now the proposal is in our hand in the end of the Commission. We have a legislative proposal that we are discussing in the REACH committee, and we hope to vote on this soon, if not the next meeting, the meeting after, and we foresee to adopt the legislation still this year in 2023. So what are the key points here? The restriction is based on the environmental risk assessment. So when we do a REACH restriction, we need to prove that there is a risk from a use of a chemical substance. And we didn't have sufficient data for a human health risk assessment, but in any case, what we had for the environment was sufficient to proceed with the restriction. We have no lower size limit in the scope. We cover all microplastics, including nanoplastics. But however, we acknowledge that we need analytical methods for implementation and enforcement of the restriction. And then in the legislation, we have a practical limit of 0.1 micrometer, which is set for enforcement purpose only, in case the restriction cannot be enforced in another way and you need really to analyze the samples. And this limit is valid until analytical methods are available. So next one. I will now go briefly into the other legislative frameworks that we are trying to progress in the DG environment. So the microplastics that are emitted unintentionally, for example, from degradation of plastic products. We have an impact assessment study ongoing, and the colleagues working on it, they started from 3 sources of emission. The plastic pellets, these are the raw materials to produce all plastic products. The tires, I mean, you know, tires degradation when driving your car, and the textiles, the emission of microfibers during washing, mostly during washing of textiles. But when the study was ongoing with the research and also the contribution by stakeholders, they found out that there were other sources that were important and they were added, specifically paints, marine paints, road markings, paints used in houses, and they, at the end, they seem to be the largest source of unintentional microplastic. Geotextiles, this is an emission source, again, from textile fibers, but not the clothes. These are used in construction, building roads, protection of coasts, and so on. And then we have the soluble films in detergent capsules for laundry and dishwasher. This is a product that many of you have probably used. And there is some concern that even if they are sold as soluble, they can emit microplastic depending on the conditions of use. So for all these sources of microplastics, the colleagues are finalizing the impact assessment, and they expect a legislative proposal still this year, but it is not yet decided which sources this is going to cover. So this is still under discussion. Next one, please. The water legislation. So here we have a work ongoing under the Water Framework Directive, the Environmental Quality Standard Directive, and the Groundwater Directive. There is a proposal of the Commission, which is now in co-decision. And the proposal foresees the development of an harmonized method to measure microplastics in all water. And when the method is available, then microplastics can be measured, monitored, and included in a watch list. The watch list is the first step before limits are set. So the legislation foresees monitoring of 2 years after microplastics have been included in the watch list, and after that limits could be set in the Environmental Quality Standard Directive and or in the Groundwater Directive. Under the Drinking Water Directive, we are more advanced because we have already the legislation adopted, and it foresees that by January 2024, the Commission needs to adopt a methodology to measure microplastics for potential inclusion in a list for monitoring and reporting. And on this, specifically in the framework of the Drinking Water Directive, there is work ongoing with the JRC to try to see what is the limit, how small we can, how much down we can go on the size. And the preliminary results, they show that for drinking water, a detection limit of 20 micrometers could be proposed. So again, this importance of the analytical methods, which I underline also for the future REACH restriction. Next one, please. This is, I think, the last one for my part. It's the food contaminants regulation. This is under the responsibility of DG Santé, and we have the work of the agency of EFSA, which started in 2016 with a statement on the presence of microplastics and nanoplastic in food. And the conclusion was that there was not sufficient information to come to a conclusion, very limited information for foods and drinking water. It was not possible to make an exposure assessment, and the risk for the human health were very much unknown. And the legislation, I mean, can advance under the food contaminants regulation only when you can do a human health risk assessment. So this is why there has not been progress on legislation on this side. And EFSA looked again at the data in May 2021, more recently, and they saw some advancement, but the scientific evidence on the human health effects is still not there, and this is confirmed also by our REACH restriction. As I said, the risk assessment for human health was not possible. We base our conclusion on the risk for the environment. I think next one is for Andrei now. Yes.
Thank you.
And I just want to let you know that you have 7 minutes for your part of the presentation. Thank you.
Okay. Unlike my my normal experience, I'll try to rush through. So I did have a few minutes before to make the promotion, so I'll just rush now with a few of my slides. In general, in terms of the policy needs, I would stress 2 aspects. Of course, one is the more generic one, that what the policy needs are is to, in a most general sense, have an integrated understanding of the problem and of the understanding of the solutions, of the impact that they might have, and to support those solutions with some operational tasks and those might then again include proper understanding of what the impact of those effectiveness of those measures might be, and so on. So this is a general issue for any policy. We need to have an integrated understanding of the situation. So in a sense of microplastics, we have identified a number of these needs before. I'm just saying that if this would be too cryptic or wouldn't make much sense, in the CUSP annual meeting of 2022, Commission has already put forward some clear research or needs for policy. and those were picked up actually in a CUSP policy brief in October 2022. You will see they more or less correspond to what I will have here on the slides. We haven't identified further needs, but maybe it's up to me to stress some particular aspects, starting with, for example, identify need for harmonized definitions, on which I also have 2 slides further on, but would start with this one. As you see, I had put N in the MNP in parentheses, and this is to stress that aspect of integrated understanding and finding solutions which and knowledge which somehow correspond to this general scope of the issue. As you have heard, when Valentina was presenting, when the Commission speaks about microplastics, it does include nanoplastic. It includes, plastics of plastic particles of all scales. There is no lower scale. It includes nanoplastics in terms of trying to understand the situation and address through the policy measures like restriction. And this understanding, this integrated understanding, needs to be followed up also as research is filling us with knowledge. Maybe understanding that we have, so that's an important aspect I wanted to share here. When we are talking about microplastics, it is microplastics at all scales, including the nanoplastics. And a few bullets which were pointed out before. So important is to fill the knowledge gaps on understanding how much of microplastics is out there, what are the mechanisms that we actually get that microplastic, either intentionally manufactured or unintentionally released. What are the release mechanisms? What are the pathways then in the environment, as well as the pathways as it enters maybe our bodies, and what is the ultimate fate? Next slide, please. Not this one, but the next one. This is a previous one. Okay, so I have just minimal slides on few of these points. I stressed already this common understanding. It is important to have definitions, maybe not necessarily in order to ensure that we have the regulation that is able to follow those regulations. We'll adapt, we'll try to be as effective as possible using, as little restrictions and constraints as possible, but to be unambiguous and effective in covering the scope it needs. So definitions are needed in order to ensure that we actually have common understanding of the problems, and that the data that we are collecting is able to be interpreted in that comprehensive understanding. And of course, it helps when we have known scopes and so on, that we can it's much more easy to fill that information in different models that can be verified by for example, by the monitoring information, which is of course always linked to specific monitoring methods which might have their scope restrictions. So interpretation is key in that sense. If we know we have certain restriction on practical sense in terms of scope, then making sure that we have we are able to make informed assumptions is very important in terms of scales and so on, and the impact of that restricted knowledge. So when we're talking standardization, there are clear needs on few aspects. So mentioned standard analytical methods for identification and quantification in different matrices, and this might mean different methods and might mean different standards. And talking about standards for the policy needs might not need only the developed method, but we need to maybe follow it up properly, develop an international standard that can be then used and referred to in regulation. We cannot forget that last step. Sometimes it's not so interesting for those that research and develop the method itself. but it's crucial for policy.
Andrea, I would like you to finish up in like
Yes.
3 minutes time due to the technical issues we had earlier. Would that be okay with you?
Yes.
Thank you.
So then the question, I put a question mark in terms of methods to support health and environmental assessments, because, for example, from experience with also nanomaterials, we might know that the methods we have developed for tox and ecotox assessments and so on sometimes may not always adequately function. We need to make sure that those assessments can be then relied upon in terms of policy intervention, which is principally predicated by information received from those, because it justifies the action. And last but not least, when we identify needs for action, we might need further standards like the performance standards in order to try to regulate different products through, for example, limiting the unintentional release from them. Next slide. This has already all been said before in terms of standardization needs that are immediate. You have heard about our plans. We need methods for those. So next slide. Of course, apart from standards, in order to monitor, we also need knowledge to be filled in all those gaps in understanding which are the sources, what are the release mechanisms. I mentioned already those, including the ultimate sink of all that plastic. The flow model might be very useful, as discussed in-house with our colleagues developing the policies, if we would understand that flow model, the whole life cycle of that plastic, that might be very useful in order to identify properly what the effective means of addressing the issue are. Of course, environmental and human health risks, the whole cluster here is dedicated to human health assessment, and we hope that it will fill some of these gaps. But we should not also forget that there might be a wider picture about the effects on ecosystem functions, which is also extremely important when we are developing the policies, to understand what the impacts of such a complex pollutant like microplastics is. Next slide. This I just pinched from the policy brief. There is a CUSP. You can see it as a promotion on a CUSP, but it's actually a challenge to CUSP. There are a lot of indications how much the research cluster can actually support. This particular research cluster can support our policy needs. It is ambitious. We are extremely happy to see that, and then we completely agree with the potential or the need behind those ambitions, and we hope they're actually being followed up properly. Next slide. This is all in the policy brief that you can of CUSP that you can see, and from some discussions which we had in.
I hate to interrupt you, Andre, but we're really running out of time.
Yeah.
So we have one last.
This is effectively the last. This is the last
Okay.
slide.
Great.
Just wanted to mention that under coverage of these policy needs, potentially there were some gaps in terms of how the individual projects are being covering our needs have been identified. So there is maybe a question put to all in terms, for example, are there all the endpoints covered which we might be interested in? The cancer potential in terms of human health impact. Potential for cancer might be covered, but reproductive toxicity, is it properly covered? But all importance is as well that all information that's collected to be fair, that it's actually can be shareable and used in the wider community that will support all the policy. And that brings to the last slide, which just summarizes both of our interventions. There are recent policies. There's still a lot of gaps, but there's already a lot of action based on precautionary principle, as you know, and the limited information we have. Important aspect of precautionary principle is also to try to fill the knowledge gaps. So we are really trying to actively work on those, or expect the research community to work on those. So thank you very much, and sorry for being late.
And thank you so much, Andre and Valentina. And thanks a lot, Andre, for jumping and helping us out with our technical challenge here this morning. That's just the way it seems to go sometimes, but we're glad that we got through your presentation without getting too much behind in our schedule. So, and with that, I would very much like to welcome Tobias Nielsen. Tobias is working at the European Environment Agency, and he actually has a background in political science. And Tobias, will you be sharing your screen, or do you want me to? Okay, good. Well, as you set that up, I will introduce you. Tobias is a circular economy expert, background in political science, and he works on how the circular economy intersects with other agendas, including biodiversity loss and climate change, and also on monitoring circular economy, and last but not least, on circular plastics and pollution. And so I'm looking forward to hearing from you, Tobias. You have 20 minutes, and we can see your slides, but we can't see the presentation mode yet.
Okay, is that better now, or?
No, but you know what? Why don't you let me share my screen?
Okay.
And then we don't lose too much time. As always, we test everything in advance, but sometimes
it was working. Yeah. Okay.
There you go.
Thanks a lot. Yeah, and thanks for smoothing it out. Okay. So my name is Tobias Nielsen. I will quickly, I think, just to give an overview of my presentation, I'll start by saying a little bit about the EEA, or the European Environment Agency, as I guess not everybody is familiar with it. Then I'll say a little bit about the types of work we've done on plastics, just to give you a flavor for the types of analysis that at least my group typically does. And then I'll go into say more about what we would like to engage with you, with this community with. And then hopefully that will inspire more discussions. So next slide, please. Just quickly on the European Environment Agency, we're based in Kongens Nytorv. Nice, great location here in Copenhagen. We're an independent agency, so we work a lot with the Commission, a lot with other EU agencies, but we are an independent agency, so we can also promote new ideas, new angles, new takes on environmental issues. So we can also sort of try and steer the debate a little bit, if you will. We also, let's see, we do a lot of what we do is we gather a lot of data from different countries, reporting in on environmental issues. We gather all these, we assess them, and we find analysis. We also, in terms of science policy, we help decision makers both at the EU level but also at national levels to make informed decisions on environmental governance. And we also support national agencies in implementing EU policy and measures, for example, on circular economy. We depend a lot on a strong community or a strong network of, for example, of research institutions to carry out a lot of the work. A lot of the heavy lifting is done by a group of different research institutes around Europe. We also have a close cooperation with other EPAs within EU and also beyond that support our work, and we are very much engaged with a sort of co-creation with them in making research that is useful for them as well. I would say that in terms of scope, we tend to look at the EU or the European level, sort of comparing the environmental state of play in different countries, different member states. That's typically our scope. We of course also include analysis of our impact outside of, beyond our borders, but that's at that sort of slightly more aggregated level that we typically operate. Next slide, please. Just to show, we have 5 different areas of work. Mine is in circular economy, resource use. Relating to you, we also have a group on human health and the environment. And on plastics, we're trying to sort of bring our work closer together. So that's so we are also engaged a lot in sort of cooperating across these different areas of work. Okay, next slide, please. So just to give you a flavor for the types of analysis that we've done on plastics. So this was from a report in 2020 that sort of came out and said, okay, for us, it's important to look at the bigger picture on plastics. So we have microplastic and plastic leakage, which is pretty much brought the whole plastic issue on the political agenda. That's a key environmental concern, but there are also other concerns, the toxicity of chemical substances, and also the fossil fuel and other pollutants that are released during production. It's also important for us to emphasize that we need to look at the whole value chain or the whole life cycle. So if you want to impact microplastic releases, we need to look further upstream as well on how plastics are produced and on the whole sort of interlinkages between the petrochemical industry and the oil and gas sector, for example. So we really need to look at this sort of this broad area, this broad context when we're trying to influence or change the plastic system. Next slide, please. So we're of course looking at a lot of the environmental problems, but we also want to engage with the solutions. So circular economy is also about promoting what types of solutions could work on reducing the environmental impacts from plastics. And so this is also one of the reports we've done where we gathered the different types of you could say solutions into 3 different pathways, we call it, on circular economy or circular plastics. So the first one is the smarter use. So how can we use plastics in a smarter way, using it for longer, reusing it more, and also using less of it. So really getting rid of the unnecessary plastic use. The other one is the increased circularity. So of course, how do we ramp up the recycling, the collection and recycling of plastics? And the last one is more on maybe the climate impacts of plastics. So how can we move towards non-fossil materials? Next slide, please. We're also looking at resolution at the leakage aspect. So this is from a report we did, sort of mapping out some of the key sources of microplastic or plastic release or microplastic releases. And from this, we focused in a lot on textiles. So we also done a lot of work on impacts of textiles. So plastic makes up around 60% of the whole textile material consumption. And so it's important to look at their environmental impact as well when we talk about plastics. Yeah, next slide, please. Another thing, this is from a recent report, is that we tend to focus a lot on, at least when it comes to circular plastics, a lot on packaging. And so it's important to remind ourselves that the vast majority of the 74% of plastic production, new products coming onto the market, are non-packaging. Of course, when we talk about waste, a lot of it is packaging because they're short-lived, but we really need to look at the other ones as well. They will stay in the economy for longer, so what we do now will have an impact further on as well. So this is just to show, all the different areas that are non-packaging, and also to say that some of the polymers that are, let's say, harder to recycle, the PVC and so on, are more heavily represented in non-packaging plastics, and also that collection rates are much lower, so there is need for more policy interventions on the non-packaging areas as well. Yeah, next slide, please. And this is another one we've done on the plastic waste exports. So we also think that we also contribute to this debate, which is ongoing, and it's been very relevant. So much of you probably know already that the European Parliament voted to or agreed that or considered to ban all types of plastic waste leaving the EU. So here we looked at the plastic waste leaving the EU. So you can see the Chinese import ban had a huge impact on our export of plastic waste. It was reduced, but it also went to other countries. And here you can see it went a lot to Malaysia, but we have done a recent study, and we can see that the trend is that it goes more and more to Turkey, which is an OECD country. And then that's the way to sort of bypass the Basel Convention, which prohibits plastic or let's say toxic plastic waste being exported to non-OECD countries. So we've seen that this is sort of, there's a concentration of, China is out of the picture, but there's a new countries that are coming on board that are receiving more and more, or they're receiving the bulk of our exports. And this is something that we need to consider how do we deal with this. Yeah, next slide, please. This is also this is from a web report that we recently published. That's looking at marine pollution, so not explicitly at plastics, but the story is very much, when we talk about marine pollution, it becomes very much a story of plastic pollution. So we can see that plastic makes up the vast majority of marine pollution. And so this is I would say, a nice graphic web report that's looking at the different sources and the extent of it. So we're also doing a lot of, you can say, sort of informing the broader public, or say the experts or in Brussels and so forth, on, you know, informing them on what the situation looks like, and also sort of, again, this is maybe a good example of the science policy interface, sort of condensing it and making these nice infographics for people to sort of quickly get into the topic. Yeah, next slide, please. Another one that especially my colleagues do, they're also looking at mapping the chemical impacts, or the impacts of toxic chemicals. So we have the human biomonitoring dashboard, which looks at different toxic chemicals, trying to map out, you know, the exposure routes and the impacts. So I brought up phthalates, which is the ones that we typically get from plastics. So here you can see the typical exposure routes. You know, how do we get them into our bodies, the different impacts associated with these on our health, and ways that you can reduce your exposure to phthalates. So we have all this for different ones, and we're trying to work with our health colleagues on bridging how we work on plastics with how they work on chemicals. Somebody in here. Next slide, please. So our typical input to the policy process is that, if you look at sort of the global level, we're part of the EU delegation at the UNEA Treaty on Plastics, and there we're trying to provide our input into to the Commission and to others. I say our take on this is that we very much want to bring forward the whole monitoring of plastics pollution on board, to make sure that there's a strong monitoring segment on microplastics and other plastic pollutions in the treaty, and that there is some kind of standardization, harmonization, so that we get similar, we operate in similar methods to provide these numbers across the different regions. We have close, as I said, close interaction with especially DG Environment, but also other DGs. I work a lot with the plastic team in DG Environment, but also we work, of course, with a lot of other colleagues. We have, as I said, this cooperation with the IONET, so that's different member states, their EPAs. So we work close with them, both supporting them and also sort of trying to harvest what are their main concerns or their main ways of working with some of these environmental issues. So also sort of bringing this up and conducting studies to support this. And then we engage as much as we can also with civil societies and industry actors. So there's a broad range of sort of ways that we input the policy process. And then the final slide, or next to final slide, is what do we want? And this is just from my side. So this is not we haven't done but at least from some of the things that I would say spring to mind is that we would like sort of an overview of new topics. So we, you know, some of the new topics and new impactful findings, informations on topics, some of these things, it would be really great to have this overview, or to have a way of getting this to us, so that, because we don't always have a lot of time to scan Google Scholar for all the latest. We of course try to do this as much as we can, but some way of getting to know this is a new interesting take on this topic, that would be great. As I said, we're trying to work on the intersection between circular plastics and also chemicals and health. So we've sort of until now worked, I mean, we worked together, but we worked on different issues. But now we're trying to say how can these two areas sort of merge closer together. We are very much interested in any kind of data streams or indicators for measuring plastics and the impacts of plastics. So this year we're starting to build what we call the Circular Metrics Lab for plastics. So that will consist of around 10 indicators that we can use to say something about the state of how circular the plastic system is. So that can be anything from measuring recycling rates to the use of recycled plastics to design, eco-design, and also on the release of microplastics to show the areas where it's not very circular, for example. So if you have any kind of good data streams that are updatable and can show us the trend, that would be very much really interested in that. We also any kind of input in the work for the plastic treaty. So as was mentioned earlier, there's a lot of data gaps. There's also a lot of data which is very much in control of the industry. So Plastic Europe tends to be the one that's always, their figures always unsighted. So we think it's important to get others that can complement this data stream so that we get sort of broader perspective on the plastic flows. Also on monitoring techniques, how can we monitor these? And how can these techniques, are these replicable in other areas of the world? I think that would be interesting input for the plastic treaty. On the exposure and the risk, are there any kind of thresholds? So this is not my strong area, but I was thinking this could be interesting to know, are there any thresholds for certain type of chemicals? And can we sort of map whether we have exceeded that in our bodies? And the more we know about the risks and the impacts beyond the smoking guns, we know there's a lot of smoking guns, there's a lot of correlations between increased exposure to chemicals and plastics and increased health dimensions, but some closer linkages would be very interesting. And then also very much encouraged, and we hope that some of you will be able to participate in some of our expert events and also in dialogues. It could also be more informal dialogues. And then any kinds of work in terms of what are good examples or good methods for preventing the release. It's also something that we're very interested in.
Tobias, you have 5 minutes.
Okay, well, I'm actually done.
Well,
so next slide, and then more time for discussion.
Okay, wonderful. Thank you so much.
Thank you for my time.
Very good. I'll introduce the next speaker, maybe while you're sharing the slides, Jane. So our next speaker is Birgit Sokol-Klücken, who is a deputy head of unit at the EU Commission's Joint Research Center in the Technologies for Health unit. She has a PhD in biology, and she works within areas such as nanotechnology, nano and microplastics, and is primarily focused on translating science into policy and addressing policy needs and communicating policy needs to researchers. And that's also how we got to know Birgit in this CUSP community. We've asked Birgit to kind of lay the foundation for a very nice, hopefully, Q&A session that we'll have in about 10 minutes time. So please, Birgit, thank you very much for joining us this morning, and the floor is yours.
Yeah, thank you very much for inviting me, Stefan and Jane. And a big thank to Valentina, Andre, and Tobias for their presentations. So, Valentina and Andre focused on the policy actions on micro nanoplastics, while Tobias gave us a bigger picture about environmental and impacts across the whole plastic life cycle. So yeah, I was also asked to summarize a bit the information from the colleagues. So what did we hear from Tobias? So he said we have a huge leakage of unintentionally released microplastic in the EU. So 0.8 to 1.7 million tons per year. And I think I also saw that there is as much microplastic in the oceans, in the soils than in the oceans, because we often hear people speaking about plastic pollution in the ocean, but not speaking about the soil. He also pointed out that our waste is a lot of single-use plastic packaging, but the largest part of plastic products is non-packaging. And these are sometimes different polymers, which are also difficult to recycle and to reduce. And Tobias reminded us that we cannot export our problems. So plastic waste export should be a no-go. And also he said that 80% of the marine litter is mismanaged waste and comes from the land. He also pointed out that plastic includes toxic chemicals as additives. And yeah, we have to consider also this. So this is the slide you see now was in the presentation from Valentina, and it provides you with an overview of policy actions within the European Green Deal. And here we have, sorry for my voice today, here we have really different action plans and strategies which also address plastic pollution and explicitly also micro and nanoplastics. And the Zero Pollution Action Plan that we heard from Valentina has really set ambitious targets. So the target is to reduce by 2030 plastic litter at sea by 50% and microplastics released to the environment by 30%. So what is the European Union, the European Mission doing on that? The next slide, please. So I would say there are in particular mitigation measures, but also closing knowledge gaps. So concerning mitigation measures, Valentina reported in particular about the intentionally added microplastics, so deliberately manufactured particles which are added to products, and hopefully soon the REACH restriction will be adopted, which would restrict such additionally added, intentionally added microplastic particles in products. Here we also heard that there is a definition included because legislation needs sometimes a definition. So what is microplastic? And we heard that the REACH definition goes down to the nanoplastic. So it covers all small particles of plastic. Then another big issue is the potential reduction of unintentionally released microplastic. So, and here we heard about an impact assessment and which evaluates policy options to reduce these unintentionally released microplastic. And the major sources which will be tackled, looked at is tire wear, fibers from textiles, microplastic from paints, geotextiles, but also the loss of pellets. Next slide, please. So beside mitigation measures, I think the Commission is in particular looking at closing knowledge gaps, and this is also related to monitoring. So we really want to understand better the presence of microplastic in the environment, drinking water and food, but also including biomonitoring. So how much microplastic is potentially already in our blood. So most advanced here is the regulation on microplastic in drinking water. There is a requirement to develop by beginning of next year a methodology to measure microplastic in drinking water. Later on, microplastic could be added to a watch list, we heard. However, the issue here is that at least for microplastic, you should add it on a watch list only if there is evidence for a human health risk. And furthermore, we heard that there are also evaluations ongoing concerning other water, so surface water, groundwater, coastal water, wastewater, and so on. Here I would like to highlight that one cannot assume that if we have a method for microplastic in drinking water, we can easily use this method also for all the other water or matrices. And yeah, that really is not so easy and straightforward, and we might need several methods. We also heard from Andre that we need harmonized and standardized methods. Maybe we even need reference materials so that we can compare the results all over Europe or even from the world, and that we can compare also results over time. So do we know how much is in the environment now in water, and can we then use this as a base level in comparison to 5 or 10 years later to see whether our mitigation measures work. So we need the monitoring of the microplastic to understand the magnitude of the pollution and to estimate the exposure of the environment and the exposure to humans. But we need also to know whether or not microplastic pose a risk. So that is, for example, given very relevant for the drinking water directive. And here we might have another knowledge gap. So do we have evidence that microplastic pose a risk to human health? And some of these knowledge gaps will hopefully be addressed by research projects also funded by the EU, including, of course, the big research cluster a lot of you are part of, and looking at the questions from the colleagues from DG Environment and from the Environmental Agency. So we need information about sources, breakdown mechanisms, pathways, fates, effects of microplastic on the environment and human health, thresholds if possible. Do we have alternatives? How do we prevent release? What are best practices, and so on? Next slide, please.
You have 1 minute left, Birgit.
Yeah, that's fine.
Okay.
So yeah. So some of the questions I would like to pose to you is really what do regulators, for example, DG Environment and environmental agencies need most urgently from the scientific community? And here we heard already some of the requests they have. And then I would like to hear from the CUSP cluster, is microplastic a risk for human health? Because this very simple question I get always if we have visitors in the Joint Research Center, and also our hierarchy where we have to justify that we work on microplastics. So the question is really, is there a risk? And then I would like to ask this great research cluster, what for you working on micro and nanoplastic is the most important scientific question to answer with respect to this problem? And if you cannot yet answer this, what hinders you to answer this question now? And when will you answer this question? And then maybe also last not least, what scientists see as most efficient policy action to tackle the micro and nanoplastic pollution? So with this, I want to finish and hand over to Stefan and Jane.
Thank you, Birgit. Wonderful and very sneaky of you. We asked you to prepare some questions for the speakers, and you prepared questions for the CUSP cluster, which is great. Good. I like that. Challenge accepted. Okay, Stefan, over to you.
Yes. Yes. So thank you very much, Birgit, and all the presenters this morning. What we would really like to do now is to open the floor to for you to pose some of the questions that you also very actively post in the chat. I would actually start off by just please raise your hand in the reaction function under Zoom, and then we'll invite you to open your mic and your camera, and then you can post a question directly to the speakers, and as you would like to. Otherwise, we'll just take some of the questions in the chat and read them aloud and address them to the speakers individually. Yes, so I see Gabor Boros. Please feel free to unmute yourself and maybe open your camera as well, and maybe you could also just introduce yourself for a minute to who you are and where you're from.
Yes, hello, my name is Gabor Bordos, and I'm from European Analytical Services, Hungary. We are a testing laboratory, and we are also doing microplastics analysis. And I would like to ask regarding the drinking water regulation that it is written in the Act that microplastics should be monitored from 2024 on. If there will be a common method agreed and approved. So is there some kind of improvement on this? I know some background because we participated in the GRC ILC test, but I don't know what are the further outcomes. So, and if there will be a common method approved, how will this watch list method be applied in the practice? So in different member countries and in different water works and producers. Thank you.
Is it Gabor, do you have a specific speaker that you'd like to address the question to, or was it, I guess, Birgit, I don't want to put you on the spot here, but you might be the one that is most knowledgeable about the assessment methods at the moment, or am I wrong?
Yeah, we are working on this together with colleagues from DG Environment. So DG Environment is in charge of the drinking water regulation, and we support them to develop something which is called an implementing act for the Drinking Water Directive. And yeah, we had discussions, intensive discussions also with stakeholders, with member state authorities in charge of the drinking water legislation. And yes, I'm optimistic that we will have a methodology beginning of next year. And this methodology, which yeah, is most probably adapted, will be a spectroscopy methodology, so based on Raman and FTIR.
Andre, do you want to come in on that as well?
Thanks. No, I think she gave the most relevant answer. I'm trying to also to quickly screen through the information that the colleague from DG Environment working on this had presented me. But yeah, I might just add some procedural points about how the acts, the supporting implementing act would work, but in terms of the content, it's there. So yes, the intention is that we have all in place in order to make that work.
Thank you. Then I see Michelle Epstein, please.
Hi.
And,
hi, can you hear me?
Yes, we hear you very well. Could you also turn on your camera if?
Yeah, I actually can't right now. Sorry.
Okay.
I would like to address my comment to Birgit. I'm in the MTOX project and part of CUSP, and you mentioned something. I mean, you asked the question of the CUSP, and you asked about what the most important issue is for human health, but we're addressing immunology and allergy, and for us that's very important. But actually, any negative adverse health effect in a human, in animals, I mean, that would be important. So I don't think that we could tell you which would be the most important, but I would say any health effect that we discover is most important. Now, or am I addressing the question that you asked incorrectly?
Birgit, I think you have to. I saw you nodding, but I don't know if you actually answered. So maybe you could unmute yourself and yeah.
Yeah, thank you very much, Michelle. Yeah, I'm sure there are many important questions to answer. But I was invited to also pose a bit provocative questions. So therefore, really, although I agree with you that there are many important questions and any adverse effect is important, it's still interesting to see where the scientists see the most, the most important issue coming up. What would, well, if you can.
So I would say, I mean, you can't pick a disease. You can't say, okay, if it's cancer or Alzheimer's, you can't say whether it's a disease, except I guess the most important thing would be something that affects a huge swath of the population. So something that would affect maybe everybody would be the most important, but not any specific disease or mechanism or process. That would be my answer. Thanks for asking the question.
Of course, we have a multitude of CUSP researchers in the call, so maybe you can also chime in on the chat, because I'm sure the answer also will depend on your perspectives.
Yes, I also actually have a question. I also posted in the chat, but I'm just wondering, like, let's say that we discover that the plastics is not a huge human health problem. Will that mean that that it stops being a problem for the environment? And will the Commission and I guess the GRC like fall down on their activities in regards to plastics in such a situation?
I can maybe try to address this quickly. I mean, as I said, in the REACH restriction, we didn't assess the risk for human health because of the lack of data. And but we have proven the risk for the environment. So from our perspective, even if we don't get to a clear reply on human health soon, the actions are going to continue. We also need to remember that this microplastic pollution is a pollution that once is there, you cannot reverse it. And this is also part of the assessment that ECHA did. So that they looked at the risk assessment that had been done for the environment up to the moment when the dossier was submitted. And one of the key issues was also this, even if we were not to a level that was in many places that was already leading to a risk, the fact that the pollution is irreversible, if it was continuing, it was clear that we were getting to the risk level for the environment. And I think that the same can be applied to human health. I mean, we are talking here about highly persistent substances that are mobile, they can go everywhere. So the only solution really, if you want to avoid the risk, is to prevent the pollution. You cannot wait for the levels to be so high that the risk is there. You need to act earlier. And this was one of the main reasons for concluding for a risk for the environment in the restriction.
Yeah, thanks, Valentina. And also comments in the chat coming in, you know, the environment is our home. So if the environment is damaged, there is a threat to human health, be it indirect or direct. Tobias wanted to come in.
Yeah, it was just, yeah, it also remind me of a cartoon in the climate change environment that said, you know, if we solve climate change, even if it was a hoax, you know, as some people believe in the beginning, we will still solve a lot of other problems. So, you know, so even if it's not a direct threat or serious threat to human health, it might solving the problem of plastic pollution will probably solve a lot of other issues, and it's still a good thing to do. So just a response to that. But I was thinking more just inspired on sort of, you know, having you know, I'm not working directly on health, but I mean, I'm interested in this, and how can we sort of move this, you know, is there any kind of good areas that we can start digging more into from CUSP perspective on sort of that sort of brings this message of plastics and human health, or even environmental health, to sort of a broader public? How can we sort of communicate this in a way? And I know because whenever we ask, and Birgit also asks this direct question, you know, what are the impacts, you know? And we always get this sort of, you know, there's so and so, but are there any things we can say, here are some definite issues on human health, and there's, you know, the increasing use of phthalates correlates with increasing or decreasing fertility rates. So something where we could sort of say, it's, you know, it's there's not the direct cause, but it's very close, and maybe we can sort of start to dig into this more, or sort of good ways of presenting this to make the message clear. What are the risks, and, you know, without overstating the impacts as well.
So I actually have a question on that as well myself, to Valentina and Andre. Thank you for that fantastic overview of the different regulatory dossiers that are addressing micro nanoplastics. Esther Kentin from Leiden University and also Thierry Rabilou mentioned that they miss packaging, specifically food contact materials. Plastic food packaging is the most prevalent type of food packaging, and it may not be as relevant for environmental exposure to unintentional microplastics. Like we now heard from Tobias that paints, or Valentina also mentioned that the paints are so important. But what in terms of direct human health exposure? And there are a couple of studies showing that if you use plastic packaging as intended, you unscrew the cap, you tear open, it generates microplastic. Excellent research coming out of JRC on this as well, from Birgit's colleagues. What is the Commission doing about this direct human exposure source?
Yeah, I mean, as I mentioned in my presentation, this is under the remit of DG Santé. So, and they use EFSA for the human health risk assessment. So both the food contaminant regulation and the food contact material regulation is based on a human health risk assessment. And currently they still don't have sufficient information to conclude on that. So I guess they are waiting for this information to be sufficient to be able to perform the risk assessment. But I mean, I agree that for sure there is a consumer exposure via food contact materials, and that should be addressed. But I think they still lack the data and the knowledge. But I don't know if there is somebody from EFSA in the audience. I don't think there are any colleagues.
We have a couple EFSA speakers. So Jean, I know you're here. Anyone else from EFSA wants to chime in on that?
Yeah, hello, good morning. I think that I will come back in my presentation later on, but certainly you're right, Valentina, because of course we are really trying to get let's say the methodology on the table, and that is not so easy because we are talking about all kind of characteristics of the micro and nanoplastic materials, and certainly it is not easy for a risk assessment to get all the methodologies on the plate, certainly not even at the moment that they are harmonized or standardized. This is where lots of organizations are working on. We try to do that together with them, and I will come back to that later. Thank you.
Thanks a lot, Jane.
I'm just wondering, as one commented also in the chat, like how will you enforce a legislation if you don't have the analytical methods to go down to 100 nanometers when it comes to plastics? Of course, I know that everybody's working hard to develop these methods, but still, will you, in theory, have a legislation that's not being enforced if those analytical methods aren't available by January 2024? Or how do you see this?
Yeah, the question I read, it was specifically on our restriction. So I won't go into the details of the drinking water directive. They have the deadline on January 24, and my knowledge is that they are working hard to meet that deadline, so they are advancing. We have a lower limit in the REACH restriction for enforcement and implementation than the one which JRC is proposing for the drinking water directive. But you need to remember that for the REACH restriction, we are dealing with microplastics that somebody put in the products intentionally. It's not something that we find in the environment and they come from many different sources. So we don't have necessary to enforce the REACH restriction only with the analytical test. You can have also a product declaration saying that microplastics have not been used in a specific product. And this is what we expect that is going to happen, that those that formulate the products, the detergent and the cosmetics, for example, they will ask their supplier, please give me ingredients without microplastics, because we have this legislation that is coming. So, I mean, the producers, they should know what is in their products. On the other hand, from a more technical point of view, we have in the definition or the scope of the restriction, you have the 1% of the microplastics that need to be in a certain in a certain range of sizes. So it's sufficient that you find a small amount of microplastic that you can actually detect, and you don't care about smaller ones that could be there if you reach the threshold of 1%. So our understanding of the products and of the products used is that you have different ranges of sizes. They cannot really produce microplastics that are all below a certain size, and then it is sufficient for the test to find those that are above, which might be a smaller part of them. So we think that all in all, we should be able to enforce the restriction once it is implemented and it enters into force. But I mean, we agree that this issue of the analytical methods will need to be solved at a certain point. And after the adoption of the restriction, we are probably going to do some work, at least to see what is there, the methods that are available, and to give some recommendation, because we cannot indeed leave the enforcement authorities alone in this task of implementing.
Yeah, thanks a lot, Valentina. And just maybe a quick reflection on this. I think the spirit of REACH really is no data, no market. And I find it really interesting that with all this plastic that's been on the market for decades and decades, it's the public authorities now that have to develop methods to measure, you know, these materials that are out there in the environment. So maybe that's also something to reflect on as we move forward with revising REACH, that, you know, in a way, there also needs to be more responsibility towards the industry to help develop these methods. And I'm being provocative here, so feel free to chime in on the chat, those folks from industry, what your thoughts are on that. I want to move to Tobias. Tobias, you mentioned how important and useful infographics are for the policymakers, and you also showed some fantastic infographics. And I kind of heard a call to researchers to make more infographics that can easily be you know, accessed by policymakers. But do you have any advice on how to do that? I mean, making good infographics is not easy. Are there any resources that researchers can use? How can they train that skill?
Well, it's a good question. Yeah, so we're fortunate that we have a big comms division here that helps us with the infographics. But I mean, one thing is making very nice, smooth infographics. So the other one is just an effective narrative. You know, if you think about how effective the message of there'll be more plastic than fish in the ocean, that really carried the whole debate really far. So it could be infographics, and they're, you know, again, getting in contact with us. Maybe there is some project we can, and then we can certainly help on sort of the more reaching broad, whereas you will be more sort of on the technical level. That's maybe one avenue we could discuss. It's not that we're not a PR, so it has to be a project that we could also see ourselves in. But other than that, I also think of the narrative, an effective narrative or effective way of discussing a certain topic, which, you know, policymakers and others can hitch on easily, and sort of it conveys the key message in a very explicit way and very easily understandable way. I think that's also a very efficient tool to get your message across.
Great. So I understand that a little bit as an invitation that we may reach out to you when we have our next policy brief in the pipeline, Stefan, right? You were leading that. By the way, did we put a link in the chat for people to see that?
Yes, we have put a link in the chat.
Great.
So that they can see the policy brief that Valentina and Andrea also were so kind to refer to. I was actually wondering, like, whether these 4-page policy briefs to summarize the work that we're doing in a huge cluster consisting of plus 70 scientists in each project, instead of is that really like the most effective way to communicate the essence of all those thousands of hours that go into the research. But it does seem that it is.
Yeah, I mean, it depends, right? I mean, it's not, if you're trying to capture everything in 4 pages, it might be, it might be too much. It might only be very vague. But if you have a sort of, this is a key message from our research, and then communicate it in even less than 4 pages, that I think that's very efficient or effective. Yeah. But also, I mean, like I said, academic papers, I mean, we're also looking at substantiating the data or substantiating the analysis. So a research paper, of course, which is sort of presenting a new take or new data or a new issue, is also something that we're interested in. So it depends a bit. And then, of course, the dialogue that you and I have had, and that's also something that we appreciate now.
Thank you. It's just trying to, like, we have so much knowledge that we want to communicate to people that are super busy, and it's quite an interesting challenge that we're definitely taking on.
12-second TikTok, Stefan. Maybe that's the next
I
policy brief format.
I hope not.
Good. Yeah, me too. Okay, I think we've had a fantastic first session. Thank you everyone for being so active in the chat. Thank you so much to Andre and Valentina, who were especially challenged with the internet, but also to Tobias and Birgit. Those were very informative presentations. We're all going to take a quick break now, 15 minutes. We'll be back at 11:15 Central European time. So that's in 15 minutes. And then we'll dive right into session 2, which will give us an update on the risk assessment. And we will finally hear from EFSA. So see you in a bit. Good.
Hello, everyone. Is it 1:45?
I think we're ready to go on, Stefan.
Yes, please. Okay, so welcome back. So I'd like to introduce the next speaker, who is Hygiene from EFSA. He's a team leader in methodology and scientific support unit at EFSA. He has a PhD in biology, a master's in environmental chemistry and toxicology, and has been working for EFSA on preparing EFSA for the future challenges related to chemical risk assessment. Please, Hygiene, the floor is all yours, and I look very much forward to learn about EFSA's activities within the field of nano and microplastics. Thank you.
Thank you so much, Jane and Stefan. Thanks for inviting me and my colleagues to come to this event. Very interesting. Of course, we are quite well realizing what is happening with the micro and nano plastics. And of course, it was also already referred to in the morning that we had some colloquia a couple of years ago, where, let's say, the issue of the micro and nanoplastics were considered. What I would like to talk to about today is particularly a sort of activity program that we have taken on board in EFSA since 2019, because at that moment we were developing the strategy 2027 for EFSA, and it was quite important to do a sort of evaluation of the state of play with respect to the chemical risk assessment methodologies that we are applying in EFSA. And I'm going to talk about it now. So next slide, please. And by the way, also thanks to my colleagues that you saw on the title slide, Chiara and Irene, who have been working very much, let's say, on the subject since a couple of years, and very happy that they could also help me with the presentation. So just starting with 2019, this is let's say, in a sort of diagram, showing to you, let's say, the different aspects of the chemical risk assessment that we are dealing with. And we also try to include in this picture the various knowledge gaps, methodology gaps that we identified in 2019, on which we would like to work in EFSA. You see on the right side, particularly in the hazard characterization, identification and characterization side, you see a couple of boxes, one of which is, of course, the classical animal experiment side, which has been focused on for many, many years as a sort of classical hazard characterization paradigm, where we try to make use of animal data to derive health-based guidance values, as they call it, for, let's say, the toxicological thresholds that we are using to say above which, let's say, the exposure would probably be of concern from a public health or a health risk assessment concern. And on the left side, you see also the exposure side. And of course, we have been talking about it this morning already. There's a lot of things ongoing. not only dedicated to micro and nanoplastics, but more in general, where we have built up quite some methodologies for making exposure assessment estimates, that is focusing on let's say, the general population, as well as on target populations for which we consider that there might be some increased exposure risk. And this is all to be combined in the risk characterization, where we are looking at what are really the actual levels of exposure that we are considering for the particular chemical, and to what extent can we already see that there are possible health risks associated with these exposures. That's the risk characterization. So this was the state of play in 2019, and we indicated also with the red boxes in particular. You see the NAM data galaxy, the new approach methods data galaxy that has been termed like this because we thought we should take on board also the non-animal experiment data, which is coming from in vitro, in silico, in chemical methodologies, which are, let's say, very much the focus of many organizations who are trying to get on board alternative data without using animal experiments. And you also see epidemiology, toxicokinetic data, human biomonitoring, which has been also addressed this morning. And I think this is this particular where we were, let's say, trying to say in the strategy 2027 of EFSA, we need to work on these in order to improve and where possible to take on board new approach methodologies, data in the risk assessments that we are doing for chemical substances, even at the nanoscale. Next slide, please. So the EFSA strategy 2027 was including, let's say, the recommendation from this stock-taking evaluation, improved quality of scientific guidance and methodologies where possible, integrate new approach methodologies-based approaches, and particularly to reduce the use of animal testing, ensure more informative risk assessments, and also going to the actions on the right side, also to indicate how we could take this on board in order to approach to achieve the targets that we set in the strategy for 2027. This was including launching experimental case studies in order to convince let's say the risk assessors, but also the risk managers, that we should make use of these new approach methodologies. We also put in place a roadmap in order to get a clearer picture on where we are with let's say alternative methodologies and what kind of recommendations we should let's say formulate in order to move into the direction of using NAMs in the chemical risk assessment. We also took on board the latest developments of artificial intelligence were, of course, emerging already for quite some time, but how we could make use of artificial intelligence tools for the integration of NAMs data in the risk assessment. And very importantly, and I would like to stress this very much, is that, of course, even if EFSA is having 450, 500 people, we cannot still do a lot of things that others can much do better, because we don't even have laboratories in EFSA, so we are working behind desks and try to make use of particularly the activities that elsewhere is carried out, and also particularly in many international platforms, including, for instance, the US EPA initiative, accelerating the pace of chemical risk assessment. That's the acronym APCRA. We have created, together with many food safety organizations, ILMIRAC, which is the International Liaison Group for Methods of Risk Assessment for Chemicals in Food. We have about 26, 27 organizations now, with whom we are, let's say, sitting around the table in order to see what are the ongoing and planned activities in chemical risk assessment methodologies. And there was one particular working group on which we are working in the direction of new approach methodologies. Next slide, please. So this is a picture of where we are currently with ongoing and planned activities. you see a couple of times the 3 dots, and the 3 dots are just to indicate that we are, let's say, increasingly having activities. And these are, let's say, the groups like working together with scientific committee and panels of EFSA, working in particular areas dedicated to particular domains in EFSA. Botanicals is one of them. We have, of course, the more methodology-driven working group of the scientific committee dealing with read across. And we also are developing now a plan to create a working group on the biomarkers of effect. Possibly some of you know that we are talking here about, let's say, NAMs, new approach methodologies, and also using NAMs in order to increase and improve the safety assessment of particular domains. But we also outsource a lot of work, and that is including the ones that we have indicated here on the left side. And I'm going to talk about a couple of them in more detail in the next coming slides. And on the right side, you see again, let's say, the international cooperation, okay? And of course, here, just mentioning the EU projects, the clusters in which we are now currently together. Next slide, please. For us, the key objectives for the short term is very much that we have a sort of increase in the number of projects that we are running in the area of new approach methodologies and improving chemical risk assessment. This includes also the micro and nanoscale considerations. And what we would like to do on the short term is we have to see what kind of knowledge has been generated and the expertise that has been built on NAM-based methods and approaches. And we also have to see after each of those deliverables that have become available, we need to evaluate the outcomes. And that is not so easy because you would like to see what are the outcomes. Are they really, let's say, meeting the expectations that we have with, let's say, starting the activity? And well, you of course know very well that evaluation from time to time is really required in order to see if your priority setting is still on the same page, if we are still, let's say, having the right directions that we have taken, if we have to bend over particular activities in another direction. And finally, and this is very important for us, we are trying to introduce these new approaches in guidance documents that we are going to prepare for all the chemical risk assessments that we are doing in EFSA. And here we have a very important component of harmonization. And I will come back to that later. Thank you. Next slide, please. So this is, let's say, I was talking about case studies. Case studies are very helpful. And that is, of course, the way that we started to do all these NAMS activities in order to convince ourselves and to risk assessors, all the experts who are dealing with chemical risk assessments in EFSA, and try also to generate evidence that in the different domains that we are covering, these case studies are delivering information which is very useful to say, this is really, let's say, convincing us that introducing NAMs, in addition to what we already have from the classical approach with animal experiments, the combination is very important to improve the chemical risk assessment. We are doing that in the different domains of EFSA because, of course, the panels dealing with pesticides or with feed additives or with, let's say, the contaminants and in the area of, let's say, nutrition, they are very much in waiting for, let's say, the evidence that we need in order to take, let's say, these NAM data that we're producing with the alternative methods to take them on board. Next slide, please. So what we also have started and launched is the NAMS roadmap. And the NAMS roadmap, in order to come to a sort of indication of, listen, this is what is already happening in the area of alternative approaches for chemical risk assessment. And we have outsourced this to a consortium which was led by Fraunhofer ITEM in Germany, but who were working together with other institutions like DTU the Free University of Amsterdam, URA, but also RIVM in Bilthoven in the Netherlands. And I think this was leading to a very important report that was published last year. And they were, let's say, creating a little bit a better picture of what is happening, what is ongoing, and what are, let's say, the recommendations that we should give to introduce these new approach methodologies in the chemical risk assessment methodologies that we use. And you can see on the left side the different recommendations in the area of we should improve the toxicokinetic assessments in order to bridge between exposure and hazard characterization. We should have a look into the tool of organ on the chip as models that we can use to predict toxicity. We should have a look at how can we integrate data from exposome to implement in adverse outcome pathways where we can, let's say, have a better understanding of the mechanism of action of particular chemicals. We need to see how we can develop additional AOPs, and the AOP networks, as they call it, adverse outcome pathways to understand these mechanisms of action of chemicals. And of course, also the human susceptibility. We have, let's say, reason to believe that there might be more knowledge now available, which is giving us more confidence in having an indication of the interhuman variability of the human susceptibility towards chemicals. On the right side, you also see that there are different phases in validation, and the different phases in validation, starting from research and development, going into let's say in situ validation, which is an important activity which is covered by particularly also by OECD and in the form of the different research projects. Of course, we need to think about working together with JRC in particular. So Birgit is here, so I know that we're going to work very much together in this because we need to work together to see how we can, let's say, have some international validation even, and also at European level of the tools and the methods that we are trying to validate. And this is going towards, let's say, at the end, the implementation in regulatory frameworks. That means that we need, in the whole process of validation, we need to go into the direction of regulatory acceptance. We need to have an understanding of the risk managers on the opinions on risk assessments that we are doing, because it might lead to a different way of communicating about the human health and environmental health risks. So this is something that we have to do. So lots of dialogue is needed here. Next slide, please. Yes, data integration, that was very important. Data integration is, let's say, one of the big focuses that we have to do in the next coming years. And we are already trying to put that in motion in the different ongoing projects and planned projects. I was talking already about artificial intelligence. We have an artificial intelligence project, artificial intelligence for NAMs, where we are trying to look into how can we make use of artificial intelligence in dealing with the huge amount of data that we are producing in chemical risk assessment, and particularly how we can make use of the modern tools that we have in order to integrate the data in the chemical risk assessment. Of course, this is also dealing with speeding up the risk assessments in particular. And we try to see with artificial intelligence experts and also with the organizations that we are, let's say, contracting to do this work, BFR, Wageningen Food Safety Research, and Define. They are working on this together with us, and we hope that there will be a final report in June 2023. So this is already quite soon. And this will be a review of the current artificial intelligence tools, particularly in how we can make use of these tools in, let's say, dealing with all the data that we need to integrate in chemical risk assessment. Next slide, please. The AI for NAMs is also making use of case studies, and you can see it here. I don't want to go too much in let's say, the details, but it is covering, let's say, an array of different types of toxic effects for which we are trying to do some case studies where we apply artificial intelligence tools in order to see how we can make use of it in the prediction of the different types of toxicity. Next slide, please.
Jean, I have to warn you, you have just about 1 minute left, so I hope that that's okay.
Okay, I will try to speed up. Okay, so, and then it's NAMS for Nano. We are talking here about a project which is a huge one because it is containing lots of case studies, but also reviewing methodology where we are making use of, let's say, the NAMS in order to bridge the gap also towards the nanoscale considerations. And this is, of course, important for your workshop today. We have started now with a first phase for which we are trying to get it started very soon, but particularly in the second phase, which is in 2024, we would like to continue with case studies on nanoplastics. And of course, here we also are moving in the direction of, in the end, guidance preparation for how to deal with, let's say, the nanoscale considerations in the risk assessment, making use of new approach methodologies. Next slide, please. So the first phase, dealing with a couple of, let's say, different lots, reviewing tools, doing some case studies in the different domains that I was also talking about earlier, and then, of course, doing some methodological and generic case studies in order to improve the methodology that can be applied to integrate NAN data. Next slide, please. The second phase will be from 2024, just mentioning that this will particularly cover also the nanoscale considerations. I think that you will have the sharing of all these slides later on, so I think you can read it later on. Next slide, please. So what we are planning to do now is we have just taking stock again. We are working on the different, the boxes that are now a little bit more highlighted in blue. So it is, let's say, the areas where we are working on in the coming years, I must say. Next slide, please. And what we would like to achieve is that we really fill data gaps in chemical risk assessment without generating new in vivo data towards a more mechanistic-based risk assessment, and certainly to enhance acceptance and confidence in the use of NAMS and IATA and biomarker data and the derivation of health-based guidance values, which is always crucial in the risk assessment, and very much focusing on international harmonization with the member states, with our sister agencies. This is the OSOR, is one substance, one assessment. We try to be consistent together with the sister agencies that we have at EU level, notably ECHA in this case. I'm talking about ILMIRAC, but also, of course, FAO, WHO, which are dealing with the joint expert committees, and OECD, of course, dealing with a lot of validation work. I think that's it. That's the last, maybe the next slide. I think that is over. Yes. Sorry for that.
No problem. Thank you very much, Jean.
Wonderful. Thank you so much, Jean. So, and with that, so we will take questions for Jean following the next two presentations. So if you've got any questions, please put them in the chat and we will get to as many as we can. I have a few for you actually already, Jean, but I will hold those because now I'm happy to welcome our next speaker, who's Todd Gown. And I hope Todd is with us. Todd, are you here? Yes, there you are. Welcome. Good morning. Todd is an environmental fate and exposure modeler. So we heard a lot about tox modeling. Now we'll hear about the exposure modeling side of risk assessment. Todd has a PhD in chemical fate modeling, and he has a lot of important steps in his biography, which I will skip over. I hope you forgive me, Todd. Just want to mention one of the more recent activities he was involved in, which is very relevant for our webinar today. He was a co-author on the 2022 WHO report on microplastics and health impacts. And I guess we will hear about that now from you. So over to you now, Todd. Thanks for being here.
Yeah, and grateful for the opportunity to present a summary of this report that was published August last year from the World Health Organization. Perhaps also important to start with a bit of a disclaimer that I'm not an employee of the World Health Organization, helped to support them in the development of the report, and so I'm not really in a position to answer any policy type questions that would be directed at WHO. So also, although I'll try to do the best that I can in terms of accurately summarizing what is in the report, please bear in mind that comments are not reflective of the WHO. So with that little bit of a disclaimer, I want to start by acknowledging all the other co-authors who helped to support the development of the report, including Alan Bubis, Fleming Cassie, Bart Coleman's, Shirley Price, Sandra Wagner, and Stephanie Wright, all of whom provided very valuable input to the development of the report, and I think deserve a lot of credit for the contributions that they provided. I also want to extend a great deal of gratitude to all of the people who provided their time and resource towards providing peer review of the earlier versions of the report, which I think really helped to strengthen the overall quality and direction that the report ended up going in. So this was really quite a big effort and covered quite a lot of ground, and the report does touch on a lot of aspects. And of course, in the time given, I can only really cover a brief summary of what's there, and focus a little bit on the exposure side and speak a little bit on the effects chapter associated with the report. So in terms of a response from the WHO, of course, I think we're all familiar with who the organization is, and that they regularly issue health-based guidelines on health and the environment, and do monitor emerging issues such as plastic that are identified as an important topic by the Health and Environment Department at WHO. They do enlist then expertise from various backgrounds and stakeholders to help support an evaluation of the science associated with such an emerging issue. And in terms of micro and nanoplastic, there have been a couple of notable reports, one in 2019, where the report really focused on exposure to microplastic in drinking water, and then this most recent report, which expands the exposure pathways to consider other dietary uptake pathways, as well as inhalation as an exposure component. Now, in helping to support at least this work in terms of micro and nanoplastic particles, it really benefited, I think, a lot from technical aspects of that went in behind the scenes, particularly with respect to a number of systematic reviews that were done in relation to the evaluating the quality of reliability and relevance of the data that are published in the peer review space, and trying to understand how we can utilize that information to get an understanding of the implications that exposure to microplastic might play with respect to human health. These are supported, for instance, from publication from Coleman et al. In 2019, where they developed a set of criteria aimed at trying to evaluate the quality of studies reporting on microplastic, nanoplastic in fresh and drinking water. And then using a similar approach, Wright et al. In 2021 evaluated a number of studies against similar types of criteria who were reporting microplastic in air. And then in a study that I led on last year, where we also developed a set of criteria to evaluate studies in terms of the reporting of adverse effects. So these data or these studies were really helpful in trying to get a sort of a good understanding of the quality of data that are in the field, and how they can help address a particular question. And a lot of this we've been hearing in these presentations relates to how can we better understand what the human risks are associated with exposure. And of course, to do that, we need to have an understanding of the quality, the reliability, and the relevance of the studies that are there, and how can they be useful for enabling a characterization of risk. And so from that, these reports then really reflect then on these data. And then what I'll do here in this presentation is really summarize some of those key takeaways. So when we talk about nano and microplastic particles and the discussions that we've been talking about through this morning, I think it's clear that there's an ubiquitous exposure that exists. And we know that these particles are in the air, they're in the water, they're in soil. And from a human perspective, our exposure is indeed ubiquitous. So we're always being exposed to these particles. If we look closely at the data, there's a lot of data then that really help to demonstrate that we clearly have an exposure to particles that are greater than 10 microns in size. And this is associated with a number of different types of foods and beverages and drinking water. But what we know we don't know really relates to these smaller size particles. And this relates to both an inhalation and an oral exposure pathway, particularly particles that are less than 10 microns in size. Now, I picked this number of 10 microns, bigger and less than 10 microns, as a way to try to sort of get a message across that it's important for us to understand the size of particles that we're perhaps exposed to, because from a toxicological perspective and physiological perspective, the behavior of particles greater than 10 microns or smaller than 10 microns will be very different once they get into the human body. So the fate of particles that are less than 10 microns, for instance, if they enter this respiratory system, the circulatory system, or digestive system, will be very different from those greater than 10 microns. And so we want to have a good understanding, particularly in relation to the toxicokinetics, or the distribution of these particles, the uptake, clearance, and elimination pathways that might be associated with particles of varying size. We know that we probably have a dermal exposure, but we really don't have a lot of understanding of what that dermal exposure looks like. And so this potentially is a research gap that we might benefit from trying to have a clear understanding of what that exposure looks like. In terms of elimination, there are a few studies that report microplastic in human stool. But again, we really don't have a full mass balance of that exposure. So we know we have particles that are coming in. We know that particles are being cleared. But in terms of the differences in terms of size and shape, I think we would benefit from having a clear understanding of what the efficiency of this clearance mechanism is from a human perspective, so we could actually characterize what is the uptake and distribution internal to us, as opposed to perhaps what's just kind of passing through us. When we look at the dietary exposure component, I make a case that perhaps we've been chasing the knowledge for quite some time, and there's a lot of reactionary responses perhaps in the way that science has evolved over the last decade or more. And a lot of this perhaps stems from an early publication in 2004 from Thompson et al., who really coined the term microplastic. And in this publication, they're really focused on the fate and presence of microplastic in the marine environment. And they do pose this question about, or sort of speculate that more research is needed to establish whether there are any environmental consequences of this debris. And they're talking, of course, about plastic debris in the marine environment. And so the focus at this point in time was really around what was in the marine environment. And if you look at the literature, you'll see a number of studies that follow from this publication that really focus on the potential accumulation and presence of microplastic in seafood and fish. And then we moved into drinking water. So we really focused in this early research on the aquatic environment being contaminated by plastic. But more recently, we, of course, are becoming aware that the atmosphere is contaminated, and we have an inhalation exposure that's taking place. Soils are contaminated, and we potentially have an exposure pathway associated with food packaging. So there's sort of this shift that's occurring over the last few years away from appreciating that the environment is contaminated by plastic debris, which is generating microplastic, to now appreciating the ubiquity of these materials and trying to get a better understanding of what the exposure might look like overall. Nevertheless, we do have a lot of studies reporting microplastic in seafood, and this is just a table reporting what the estimates of per capita daily consumption might be associated with microplastic particles in various types of seafood from various groups. I don't want to really dwell too much on this table. I just really want to focus on the sizes that groups have been reporting up to date. And you'll see that the majority of these studies are reporting particles that are quite large, so typically greater than 50 microns in size, for instance. And in 2016, when EFSA also looked at this data, they also reflected on the lack of data for particles less than 150 microns in size. And again, also emphasize the need for us to better understand these smaller size particles, because these smaller size particles are the ones that potentially have greater concern from a toxicity perspective, but we would also benefit from better understanding of the toxicokinetics. What is the uptake, distribution, clearance, elimination of these smaller particles versus those larger size particles? The other thing in the 2016 report is that they also reflect a greater need on trying to better understand the role of food processing in terms of acting as a potential source of contamination of microplastic to different types of foods and beverages. So of course, at this time, we really didn't have a lot of data to speculate on what the potential human health implications are associated with this type of exposure. Now, a key challenge that we've sort of been reflecting on in some of the discussions that I've heard this morning does relate to the complexity of the stressor that we're talking about. Nano and microplastic particles represent a heterogeneous mixture of particles of varying size, shape. There are different surface chemistries, and the different surface chemistries can trigger different toxicological responses associated with them. Also, there are a number of different types of polymers that are associated with the plastic that we're talking about, and then depending on how these plastic materials are used in commerce, the type of polymer it is, can result in differences in terms of the chemical additive that might be associated with a certain type of particle. So if you're asking people to go out and monitor for micro nanoplastic particles, well, what is it that they actually need to monitor for? And our analytical methods can only do so much. Can they really address the complete complexity of this stressor to help us understand what we're exposed to, or are there limitations? And I think it's clear that there are a lot of analytical limitations, particularly with respect to size, polymeric composition, that make it challenging for us to get a full picture of what that exposure looks like. So we know it's ubiquitous, but the data that we have are really perhaps limited to looking at the total space that this stressor represents from the physical properties associated with the material. So this makes it, I think, important to reflect upon, because we want to better understand what the sources of contamination are. So we need analytical methods to help us do that. We have, as I say, been focusing on the marine environment as being contaminated and going out and then collecting seafood and fish and then analyzing these samples, developing methods to help analyze these samples for specific types of particles, which again have limits in terms of the sizes and shapes that are associated with these materials. There is this move towards appreciating food processing and or packaging, as well as atmospheric deposition as potential sources of contamination. And so in developing these methods, we do want to have a better understanding towards characterizing and quantifying what are the significant sources of exposure, because if we understand that, then we can introduce very effective and efficient mitigation measures to help reduce what the release of these materials be in the environment and thereby reduce the exposure. So the shift, this is pretty much saying the same thing, so I'll just kind of skip over this maybe. So it's just a shift away from the environment being contaminated by microplastic particles and coming back to us in food that might accumulate, towards perhaps better appreciating that food processing and or packaging component. And again, using this information to help direct mitigative measures moving forward. Now, whether we're talking about analytical methods or toxicity effect test systems, we do want to really have good quality data to help inform that decision-making process. And I think that's been reflected by the various speakers today, that this is really important, because if we want to have a science-based decision-making process in place, we do want to have robust data to support that. So we do continue to have a lack of standard methods, particularly to address the broad suite of different types of foods and beverages that exist in environmental matrices. And a lot of the studies that we currently have in play do lack analytical verification, and there are concerns around what it is they've actually identified in a number of studies. And then this concern regarding background contamination also continues to be a major concern. And so groups really need to focus on development of standard methods that are robust and do address a number of the criteria that have been raised. Now, I think it's also been mentioned, this tends to be the non-sexy part of doing research, but it's really critical to have the fundamental methods in place so that we can actually have a good understanding of what that exposure would be towards helping address a number of concerns that people have with respect to this particular issue. So in terms of dietary exposure of microplastic particles, the concerns regarding the representatives of food and beverage categories that have been studied to date does represent a major area of research that's kind of needed. And this has been addressed in a number of publications that have come out over the last, again, several years. In particular, a study from Cox et al., where they provided perhaps the first initial assessment of what our human exposure might be. And in their assessment, which I think is consistent with what we saw in the WHO report, is that there's a real strong underrepresentation of the types of foods and beverages that are there. Cox et al. Suggests that only approximately 15% of an American's typical daily caloric intake is captured in the types of foods and beverages that we're seeing. And as a result of that, their study really focused on inhalation exposures potentially being much more important than the dietary exposure pathway. But do we really know? Because we really don't have a true understanding of what our exposure is. In the study from Mohammed Noor et al., they really did focus on trying to develop then a probabilistic approach to try to address a lot of the uncertainty in the data to come up with an estimate of what a human exposure would be through their lifetime. But we still need to address, I think, this underrepresentation of the human daily caloric intake and get a better understanding of representative foods and beverages. The other part of this, of course, is whether or not there are cultural, socioeconomic, age, and gender differences that should be taken into consideration. And I think this has been mentioned a little bit, but this also represents an important aspect moving forward. So in terms of moving forward, from an exposure assessment perspective, I think it's important to try to develop holistic approaches that consider the total food basket and which evaluate potential sources throughout the whole life cycle. A message that I think has been mentioned in other presentations as well. So of course, the environment can be contaminated, a source of contamination for the foods as they're being produced in the field, for instance. But then if we could really think about what's happening during the manufacturing process, I think companies can then identify potential inputs of particles during that processing stages and whether or not packaging is more important than the processing, and then introduce effective mitigation strategies to help reduce the exposure. But something we should also be thinking about is what happens when you bring foods home and prepare them in your own house, and whether or not that could act as a significant source of contamination is something that I think we would benefit from additional research. So if you have carpets in your house, for instance, and depending on how you prepare your foods and beverages on a plastic cutting board, you may be introducing a source of contamination as a result of your own personal behavior. So consumer use and habits, I think, also represents an important data need. So the key messages from the exposure component are, I think, quite simple. We do have a ubiquitous exposure that occurs, but information on exposure from air, drinking water, food, and beverages continues to be limited. And so we need data on the characteristics of microplastic and their quantification in all important media, which are necessary with the need to better understand their sources, useful for helping to introduce effective mitigation strategies moving forward. In terms of the effects data, in the interest of time, I can't cover all of this, but I think it's important to sort of note that we did go through a number of studies to try to evaluate them against these very specific criteria, categorized into three areas of particle characterization, how well they report on the study design. And then I think an important aspect, because we're being asked to consider risk, is the fit for purpose of how fit for purpose a particular study was. Was it applicable or generating data that were applicable for risk assessment? It's not to say that if a study performs poorly in terms of these criteria, that it's not providing useful information. There can be very valuable mechanistic insight gained from a particular study. But if it's missing aspects that are important from a risk assessment perspective, it's not going to be useful for that particular purpose. So just to give a quick summary of how studies scored overall, I think you can see that there's a lot of variability in the overall scoring of these studies, with some studies that do perform quite well in terms of their reporting a number of aspects from the study, from particle characterization, experimental study design, and applicability for risk assessment. But you'll see that a number of studies continue to perform poorly in terms of their applicability for risk assessment, and so are not providing useful information to inform that decision-making process. And so just to sort of highlight a couple of key consistent areas where studies were not performing well was that there were few studies with a dose-response relationship that had any environmental relevance associated with it. And I say that because a number of these studies we're talking about really are dominated by a group of polystyrene spheres of less than 10 microns, whereas the exposure data we have are of particles that are much greater size. And so there's a mismatch between the types of data that are being generated in these studies and the effects or in the exposure data. So to do a risk assessment, we need to be able to compare like to like. And at the moment, that's not really something we can do very effectively. So there are a number of key messages that come from the effects chapter. These include really a need for better standard methods associated with exposure in terms of moving forward, and really around strengthening the QA/QC. Effectively, the available data are insufficient to determine whether exposure to nanomicroplastic particles in the environment is associated with any direct or indirect characteristic pathology, simply because the concern around the QA/QC has been poorly accounted for in the published studies that we have. So a key thing is how we can prioritize research moving forward. Clearly, we have a number of studies that report negative effects in the lab. However, there are concerns around the QA/QC around those studies and how they reflect the actual exposure we see in the environment, which we know we have an exposure to. But all of this information does not enable us to perform a risk assessment. So we still have this challenge of, if we want to do a risk assessment, can we get better data to help support that moving forward? So in terms of research needs, standard methods are clearly needed, and this is both in terms of the sampling side, but also in terms of the effects testing side. And to help support all of this moving forward, there's a real need to have reference materials or standards that are representative materials of what we might find in the environment. And at the moment, there's might liken it a little bit to the Wild West, where groups are producing their own types of materials and studying these in the lab, but there's no direct relationship to what we have in the real world. And so there's a need for us to better understand that. And I know I have like 1 minute, so
less.
So I'm pretty much done. I mean, the other part of that is really trying to better understand sources, and so we can help to introduce mitigative efforts moving forward. And most importantly, from a human exposure component, is to better understand the toxicokinetics, I think is a key aspect. So thanks for your attention.
Thanks so much, Todd. Fabulous talk. We'll also get to questions for you. But first, over to Stefan, who will introduce our next speaker.
Yes, so I would also like to thank you, Todd, for your participation. And with that, I would also like to introduce our next speaker, who is Alba Hernandez. She's a coordinator of one of the CUSP projects, namely PlasticHeal, and she's also the current chair of CUSP. She's an aggregated professor and head of the mutagenicity group at the Autonomous University of Barcelona, and she's an expert in human health impacts of chronic contaminants of emerging concern, especially microplastics. We invited Alba to give some reflections on what we've heard Todd and Jean talk about, and also hopefully she will spark off or kick off the following Q&A that we'll have leading up till lunch. So with that, Alba, please, the floor is yours.
Okay, thanks a lot, Stephen. Thanks for the introduction, and a big thank you for the presenters. They gave really nice talks, so I have a lot here to pick up and continue discussing. So I'm going to share my screen. Hopefully you are able to see that.
Yes.
In the presentation mode, okay?
Yes.
So we had our colleagues from EFSA explaining an approach based on new approach methodologies to conduct risk assessment, minimizing the use of animal testing and ensuring that we will get mechanistic insight. I think that this is a key message from the talk that we have there. And then we have our colleague Todd that explain or give an overview of what is the report from the World Health Organization talking about micro and nanoplastic exposure. And if you have the opportunity, well, by listening to him, and also if you get the opportunity to go more deep into the report, you would see that one of the conclusions is that the characterization and quantification of exposure to micro and nanoplastics and the associated human health effects are, and I highlighted this, incomplete and insufficient right now for risk assessment. So it's kind of surprising for me. This report is following another one. The last one, I think it's from 2016. Some of our colleagues in the previous presentations also mentioning that. So how is that the conclusion is more or less the same in a report that's more or less 5 years apart one from the other? What have not done in our studies that has produce little advances on this regard. So with these overall messages, I have picked or identified some questions that I think that can be key for two reasons. The first is that they have the potential to impact our investigations. So we need to understand those to be able to plan ahead and to reshape our approaches according to these questions. And the other one is, of course, to understand how we as scientists can contribute to address some of these questions, these issues, these gaps. So the first one that I have identified is something that has been addressed by, I would say, all the speakers, today's speakers, which is the thing or the issue about definitions. There's many properties that we can take into account when defining what's micro and nanoplastics, and only if we consider just size, we can see that for our speakers today, there may be differences in what is the frontier between a nano and a microplastics. Of course, this is really important, and that's why everybody has highlighted this point. And then I wonder whether if we in the cluster, if we in CUSP, are putting this in front or in the top priorities, because if everybody identifies this as a problem, I'm assuming that this should be on top of our goals. Then these definitions are, no matter which one, are in this regard of the additive content in the plastics. But then can we or should we separate particle effect from additives effect? How can we do that? Is it possible to do that? Do we have enough understanding of what is the leaching or the release of these additives from plastics that we can really perform studies or plan studies to address this? And how can do that if we move towards true-to-life materials, more realistic in terms of the environment? These true-to-life materials will contain additives, so there's no possibility for us to really separate those from the particle. How are we going to discriminate this? So, and then should we consider additives in the frameworks that we are developing for micro and nanoplastics, and how are we going to consider these, taking into account that we have these limitations? Another thing that has been mentioned in today's presentations is if it's possible to have suitable reference standards representative of the environmentally relevant micro nanoplastics. Then there's a lot of avenues to think about. What would be the most relevant polymers, and what is the source of these most relevant polymers that are important for human health? What is the method that we're going to use to really get these most relevant micro nanoplastics, and how we're going to characterize this afterwards, as this is in relation with the previous point of definitions? Are we going to consider the modulatory factors that can modulate the properties like aging, digestion, contact with food matrices, etc.? And how are we going to disperse these more relevant materials for toxicological studies? So there's a lot of questions here that need to somehow be solved in order to have a catalog of what we consider is the reference standards. I guess that most of these answers, to these questions are determined by the environmental scenario. So the most relevant would be what we found actually out there. But how can we know what is out there if we don't have the analytical methodology to really find them, identify them, and characterize them? And then can we characterize and quantify exposure to micro nanoplastics? This is just a part of a figure of the presentation from our EFSA colleagues, where you see the relationship between internal and external exposure and the different factors that they highlighted as important in this NAMS-based approach. And they stated epidemiology, human biomonitoring, toxicokinetics, occurrence and consumption and inhalation data. All of these would need to the development of these analytical workflows. It would be actually challenging for any chemical to try to understand this, but it's even more difficult, or specifically difficult, for plastics due to these limitations. And then another thing that I have picked up is the new approach methodology data galaxy that were in the presentation of our ESA colleagues, where you see there different possibilities of having in silico, in vivo alternatives, in vitro omics data as important data to be able to conduct risk assessment. But then again, lots of avenues there, even for a chemical, the choice, what is the choice of the best model? What is the methodology that we're gonna use? What is the exposure scenario that we're gonna conduct with these models? Do we know what are the more relevant endpoints for our particular stressor? And how can we connect with the available in vivo data that has been previously produced to really see if we can, together with in vitro and in vivo data, perform risk assessment? What is the accessibility for this? As I said, this is difficult for chemicals, even more difficult for micro and nanoplastic, because if we learn from the report of the WHO, we will see that most of the data that has been generated so far relies on an ecotoxicological perspectives. So probably we need to wonder whether the choice of the models or the endpoints or the exposure scenario really is matters for human health. Most of these models also are following non-standardized methodologies. The more realistic the model, the more complicated the model, the more fancy is the model inside the lab, trying to mimic what is the animal scenario, the less are available SOPs for this. And then how can we combine, or how can we balance this with one of the conclusions of the WHO report that says that we need data that relies on more robust, quality assured methods and analytics to better understand the micro nanoplastic impact. So how can we balance this to be able to produce data that don't have the risk to have low regulatory acceptance? And then the last couple of points would be the identification of potential susceptible human population groups. This has been highlighted by both speakers in this session. And then for chemicals, traditionally, this susceptibility has been fundamented not only, but mostly on polymorphisms of xenobiotic metabolism. But this scenario is not useful for micro and nanoplastics. So we need to think in other potential sources of susceptibility based on what we know from the potential effects of particles or the data that has been published so far. Looks like the inflammatory pathway, it's something important. Then maybe we need to think on susceptible human populations being those with previous pathologies related to the inflammatory pathway. But we need to figure out a new way to understand this individual susceptibility. And then the last is the question if just to reflect if we are paying enough attention to quality assurance and quality control in light of the data from the WHO report. Looks like many research papers that are published do not fulfill this requirement, and then it won't be used by regulators. So basically that's it. I finished.
Thank you. Yeah. Thank you very much, Alba. It was very insightful and informative. And with that, I think we would just like we did earlier this morning, open the floor for people that have questions and want to raise their hand and open their mics and cameras to post them.
And we can ask all the speakers actually to keep their cameras on and the microphones.
Yes.
open so that we can see you and hear you.
Yeah. Maybe Jane, maybe you could kick off the session, because you said you had some burning questions to Jean, and kind of like
yeah. Well, I do. I mean, first of all, I think it was a really fascinating session, and I actually want to start with a question to Todd, if I'm allowed to, Stefan, because Todd, you presented this really nice study where you looked at. Are you there, Todd? Ah, yeah, there you are. Great. Where you looked at the different studies and looked at whether they fulfilled their fit for purpose to use in risk assessment criteria, and I think that's a really interesting approach. I was wondering two things. First of all, did you actually also take into consideration what the technical or methodological limitations are right now? I mean, you have this wish list, like this would be ideal, the gold standard, but we've heard now repeatedly there are a lot of gaps, right? Methodological gaps. We simply can't measure below 20 micrometers, 10 micrometers, and so on. So, you know, it's one thing to ask for that information, but if it cannot be provided, it also can't be reported, right? So I think that is there some kind of way to acknowledge that? And the other question I would have is, what's your advice to our CUSP researchers or any researchers working on empirical studies right now, measuring micro nanoplastics, either tox or exposure? What do they need to consider if they want to make their studies and their data relevant for risk assessment?
I think on the first question, so from an exposure perspective, from the monitoring data to get below 10 microns is a real challenge, of course, and there are technologies that are sort of moving forward, and not to say that I have any real answers to how to address that. I do know, for instance, you have pyrolysis, GCMS, for instance, methods that are available, and if we couple that with different filtration methods, we might be able to get to lower size components, and then we're reporting data on a mass basis as opposed to a particle count basis. And this is another topic that I don't think has really been covered, but the units that we're talking about also become somewhat problematic. So studies reporting concentrations in terms of particles per volume or particles per mass, and then how do we convert that to information that we have from the effects studies, which might also be reporting in different types of dose metrics. So there's sort of a need for us to standardize how we're reporting the data from that perspective, which might change depending on the types of size that we're working with. And so I think, yeah, we need to sort of reflect a lot on the dose metric that we're reporting on. Ideally, the more information that can be reported can be useful for helping to perhaps translate some of the monitoring data to reflect what people are reporting in the effects studies. On the effects studies, in terms of the quality assurance QA/QC criteria that we're using on the effects side, I sort of saw the approach more as a screening and prioritization exercise. So that tool that we developed was really to try to screen studies. And so with me having a background in environmental fate and exposure studies, I could at least have some technical aspects where I could, go through the paper and identify things that are being reported, not being reported. But what we found, so I was also involved in an activity in California where they have a directive to come up with a human health threshold number for drinking water. And within that context, we did have an expert group to have a second tier of evaluation. So we had a number of studies on reprotox, for instance, that were being reported. And when we brought those experts in, there are a number of aspects associated with those studies that they identified, which were also sort of missing in terms of how well the study performed, which I could never have identified. So I think when generating effects data, then people really need to be paying attention to all the very important aspects of how a study is designed. If it's a reprotox study, for instance, then you need to be addressing a very standard protocol for any type of chemical that might be used. So always reflect, I think, in terms of that component, because if you're generating data, you want to ensure that the information can be compared from one group to another group. And this is where the reference materials becomes important, because if you're getting your materials from Sigma Eldridge and another group is getting theirs from another supplier, yeah, again, we're not having a good comparison, and we don't know what these particles are. So
Yeah.
there's quite a lot in terms of trying to respond to the question, but yeah, there's no easy answer.
No easy answer. Yeah, I get that one. And also there were a couple of comments on the reference materials, but I think Abba did a good job addressing that, that it's not so easy. It's kind of part of the challenge. Stefan, if I may, I will ask Jean briefly about, well, first of all, Jean, thank you so much. I think it's really, really interesting to see how EFSA is embracing the NAMs. Of course, you know, what we would all like to know, and you probably can't answer that because it's actually a risk management question, but when will we be classifying chemicals like carcinogens and reprotoxicants based on NAMs? I think that's probably the first step. I think that would be nice to see that, because right now you still need in vivo data actually to classify chemicals as CMRs. But I was wondering, you know, about the AOPs, which I know a lot of people are working on those, and it's obviously really intriguing from a scientific point of view to understand, you know, the mechanisms how a chemical can cause toxicity, but that can also kind of take you down a very deep rabbit hole, meaning that AOP development can take a lot of time and a lot of resources. And so there's an alternative approach which was actually developed by WHO. It's a cancer research agency, the key characteristics of toxicants. Are you aware of this, and how's EFSA working with key characteristics as an alternative, a conceptual framework to work with NAMs?
I'm personally not really, let's say, familiar with that. You know, there are a lot of things that we are currently dealing with, but maybe if I may, Jane, because there was something that I would like to share with you, which is because I think that the focus that we are currently having, particularly in the nanoparticles area, is particularly the toxicokinetics and particularly bioavailability of the particles, which is very difficult matter. But my colleague is let's say, involved in the workshop as well. Would you mind if I give her the floor? Because I was asking her if she could tell a little bit about, let's say, the technical requirements, the technical guidance that we are trying to implement at the moment, which is really addressing this. And it's particularly important for you and for the workshop. I think that people know that there are lots of discussions here, and particularly it's also related to characterization of the particles and size, dimension, whatever. Okay.
Sure, I think she can take 1 or 2 minutes. Yes. That would be great. Thanks.
So Chiara is here.
Yeah. Good morning, everyone. Thanks a lot. Thank you all for organizing this interesting event. Indeed. Yeah, just to relevant to mention that some further guidance.
Chiara, your internet connection seems to be a bit unstable. Maybe you turn off your video. That may help. Although we like to see people's faces, but in this case. Otherwise, Jean, you're going to have to jump in.
Yeah, I think so. There she
is. She's back. Okay.
Yeah, I'm sorry. Zoom had an unexpected problem with me now. Okay, no, anyway, it was just to thank you for organizing this interesting event. And yeah, as Jean was mentioning, maybe it may be worthy to integrate to the discussion the recently published EFSA nano guidances that may provide further help in this topic. And further guidance specifically. You may know that these guidances cover the assessment of conventional material, possibly containing nanoparticles and nanomaterials engineered as such. These guidances are not focused on regulated products specifically. However, the provisions can indeed be followed for the assessment of contaminants and specifically nanoplastics. However, it might be indeed relevant to specify in this sense that a specific guidance on nanoplastics will be developed in the next year by EFSA in the context of a new project, the EFSA Lamps for Nano project that was quickly mentioned by Jean. that will indeed go through the specifically assessment of nanoparticles. Then maybe thank you for sharing the link. Indeed, I also noticed a question in the chat on the importance of in vitro data, and anyway on the difficulties with respect to researchers to present this data to regulatory authorities. You may know that the EFSA nano guidances address the importance and how to rely on in vitro and NAMS-based data during the risk assessment process. And here I think that would be important to mention that not only validated but valid methods are accepted throughout the risk assessment process. And in such cases, what it would be crucial is to rely on an international protocol, such as those that were developed from European projects, such as this one. And what is really important from us is the good reporting, so the high level of reporting of data in order to verify the usability in a regulatory risk assessment. I'm not sure, Jean, if you wanted to add some other
I think it's perfect because I think that what we need to share with you all is the fact that we had already discussions about detection of nanoparticles many years ago. And since then, we came into a sort of flow of lots of activities dealing with that in the best possible way. And what is important is that we are still working on it because it's not so easy. And particularly standardization of methodologies is really, let's say, the focus that we have currently at the moment. And we are trying to work together with many different organizations in the EU, but also outside in order to get it better. It's only a handful of laboratories who are capable of producing comparable data on the amount of nanoparticles that we're talking about. So this is really where we have a problem of how can we make use of the current knowledge for a risk assessment? Well, that's where we are.
Yeah, thanks, Jean and Chiara. And again, my thought from the previous session, these materials are on the market. I think that needs to also be addressed by our risk managers in the absence of methods to reflect on what can we do, because we can chase the knowledge, as Todd said, for years and years, and these materials will continue to be on the market and people will be continually exposed. Stefan, you want to?
Yes, I was just wondering with the what about the non-animal studies? I think there was a very important question raised in the chat about that, and that the fact that regulatory agencies seem to be hesitant in accepting non-animal studies in their risk assessments. And as far as I understand from some of the authorities in Europe, it's because they are seeing that there's a high level of false positives when they look at the non-animal studies and then require, for instance, registrants under REACH to produce full animal studies, that they don't show any risk, and therefore they're hesitant in relying fully on non-animal studies. But on the other hand, that seems to be where everybody is moving. So I'd really like to hear your opinions on this, both the World Health Organization, that you've plowed through all of these studies, and also EFSA as a risk assessment authority that advises the Commission.
Shall I start, Stefan?
Yes, please. Yes.
No, just you're completely right, because this is also the reason that in 2019, when we were talking with our colleagues in particular, not only in the panels and the committee, but also people in GRC, we have been brainstorming about the issue of we are, let's say, having the problems, and maybe there will be an EU policy at a certain moment which is really blocking the use of animal experiments anymore. And this is, of course, the way that we are, let's say, anticipating that probably in the future we should consider making use of NAMs in the best possible way. But the problem that we have and that we sensed in a couple of years ago is that we need to work on convincing our own risk assessors, our own experts in using data from new approach methodologies, particularly in the chemical risk assessment, and particularly where we are having the crucial target that we always have to think about what is the health-based guidance value that we have to use for the hazard characterization of chemical substances, and certainly also for the nanofractions. But certainly here, there is, we need to have, let's say, those case studies that I was talking about in order to convince even the experts that we should make use of it. But we have those discussions about, yeah, but how predictive are these NAMS data for the particular toxic effects that we have been classically looking at in the past? This is the current classical paradigm that we're using in chemical risk assessment. And this is exactly where we need to work on, yeah, but can we not make use of complementary data coming from the new approach methodologies, coming from IATA, coming from let's say, integrating all kind of data which is non-animal related, but coming from in vitro and in silico, etc. And we try to validate those methodologies for that reason. So I really think we need to convince our own experts, the risk assessors, risk assessment community, and certainly also the users of the risk assessment that we are producing. It's not so easy. And certainly the risk managers should also be looking at it. And of course, and that is also what we should not forget, there was lots of debate from stakeholders who are not convinced that we should go that direction, which is maybe sometimes a little bit more political. But that is really something that I would like to put on the table.
Yeah, maybe I can also just chime in here. I mean, I hear you. I do think we have to acknowledge that moving away from in vivo testing means we are increasing the scientific uncertainty. That is a fact, there's no doubt about that. But I do think that, as you said, it is a political issue, and there's a very strong will to reduce animal testing. And so I think we also have to be clear about what the alternatives are. Either we have exposure to materials and chemicals that are not assessed properly for their safety, and that also includes animals, by the way, wildlife and so on that get exposed, or we have to limit what materials and chemicals are authorized and allowed on the market. And that's actually what REACH is trying to do, right? And I also think we need to kind of mention here that not all NAMs are equal. I do think that there are some really good in vitro assays out there which can be used for predictive hazard assessment, whereas with in silico approaches, garbage in, garbage out, right? So you really have to know what the data is that goes into the models in order to understand what are the associated uncertainties. But I do think, regulating based on in vitro people should feel more comfortable with that. That's my personal opinion. Okay, Stefan, we're at the full hour. We said we would take a lunch break for half an hour to let people relax a bit. I don't know, do you want to close us off?
No, I just want to thank everybody for their active participation, and especially the speakers for some very enlightening presentations. And then after lunch, we'll introduce you to what the individual projects in the CUSP cluster are doing. And we'll also have a discussion about how can we collectively address some of the many research gaps that were introduced to us this morning. But with that, look forward to continue the workshop after lunch, and want to wish you a wonderful lunch. And we'll see you back at 12:30 sharp on time, so that we get into our third session on time. So see you then. So, welcome back from the lunch, everyone. I hope you had a good break. I had my lunch on the terrace here in the sunshine, which was nice. And I was thinking, how many microplastics am I eating now? So that brings us straight back to the topic and brings us to the CUSP research projects, because that in part is one of the jobs of CUSP, to find out how humans are exposed and what the health impacts are.
And so now we will hear from all the 5 different CUSP projects. We have speakers from each of the 5 projects here with us today. And the first speaker will be Steffen Voss-Hansen, whom you know already. He will be speaking on behalf of PlasticHeal. And directly following Steffen, we will have the other projects. So without further ado, Steffen, I give the floor to you and I will pull up your slides.
Sounds perfect.
Good.
I'm very jealous of your terrace and the sunshine. Like we have like gray rain here in Denmark, and it's very the opposite of depressing. Not
well, I send you some sunshine over the Zoom interface.
Okay. Thank you very much. Yes. Okay. So in this talk or in the next 10 minutes, I will present some of the work that we're trying to do in PlasticHeal in regards to addressing some of the research gaps identified by the authorities and the regulators that we heard about this morning. So if you change my slide, please. So the aim of our work in PlasticHeal is eventually to develop a framework for risk evaluation, and specifically in the project proposal we wrote that we would develop innovative tools to study the impact and mode of action of micro and nanoplastics on human health, and thereby build a knowledge base for risk assessment. At this point in time, we do not quite know what this risk evaluation framework will look like, but we're simply like we're taking steps, and as long as we can kind of see 2 steps ahead of us, we believe that eventually we will reach the target by the end of or beginning of 25. So we have a few tasks that we've planned, and some of them we've also already completed. But the first task is to do a stakeholder consultation. That is followed up by a gap analysis, which is due next month. And then we're also going to collect all the scientific input from all the other work packages in PlasticHeal and kind of see what kind of dish can we make up from all of those inputs, and what can we kind of bring forward when it comes to developing a risk evaluation framework. And then finally, we're going to develop the framework. Next slide, please. So as I mentioned, like we've completed a stakeholder consultation. So basically what we did is we identified stakeholders through all the different public consultations that has been in the last 10 years completed by the Commission. And then we developed an online survey where we asked people to provide input on what they consider to be the most important knowledge gaps when it comes to plastic pollution. So those key knowledge gaps, key regulatory needs, and key regulatory gaps. And we're doing a number of follow-up interviews. And I just wanted to mention in this setting for all the participants in this workshop that the survey is actually still open, and you're more than welcome to use the QR code on this slide to actually provide your input to this survey. Next slide, please. So another part of our work that we've done is we actually completed a survey amongst all the CUSP researchers to understand what kind of research are they doing and where does it fit into a risk assessment framework. So in this case, what you see you don't see it because the text is so small, but on the x-axis, you have all the information requirements under REACH when it comes to human health hazard assessment. And there we asked all the researchers to kind of sketch where is it that they would generate data that we could then eventually use in a hazard assessment. And you see the distribution, and there's definitely some areas where we're developing a lot of data, for instance, non-animal data and so forth. And there's definitely also areas where we're not developing so much data. And that's very important for us to know, because if there's key data that we might be missing, then that might be a problem later on. Next slide, please. So this is actually some of the input requirements that nobody is looking at so far, or at least at the time that we completed the survey. So next slide. And like what you can see is that they're grouped into different categories. So there's some basic properties of plastics that nobody is addressing, and that might be because they're not so relevant. There's some information about skin and eye irritation. There's something about reproductive toxicity. And then there's mode of action and the derivatization of DNAILs. Subsequently, we realized that some of the projects in CUSP are dealing with this. Next slide, please. There's, for instance, PlasticHeal that are looking at what happens on a population level, also the variation of DNAILs. And then there's, next slide, please, there's also Aurora that is looking very much into reproductive toxicity. So we actually do think that most of the components that, are actually addressed. Next slide. Some of the key gaps that we've identified have already been mentioned several times in the earlier presentations, and that's also due to the fact that these gaps have been identified through the process in collaboration with the different organizations and regulatory agencies that have presented. So it's something about the application of definitions, existing tonnage thresholds, suitability of current information requirements, and then in the end, how do we actually enforce the regulation that's in place? Next slide, please. As Andrea and Valentina from DG Environment mentioned, we've kind of used all that information to prepare a policy brief, and you can find a link to that on this slide. We will develop further policy briefs where we will try to explain after 18 months how the CUSP projects have actually helped address some of the research gaps or the regulatory gaps that we've identified in the first policy brief. And then at the end of all the CUSP projects, we'll prepare a final policy brief that again explains all the findings and put them into a regulatory context. Next slide, please. We're also doing a lot of work continuously trying to understand how different research projects are addressing different research needs. And all of that information we're putting into an online database called the PlasticHeal database. And here you can actually go to this website and search for information on all the different projects that we have identified all over the world that deal with the risks of plastics. And you can do all kinds of cross-cutting analysis there. Like if you go to the next slide, I have to mention it's work in progress, but in theory, you could distribute projects according to which knowledge gaps they're addressing, how much funding each is addressed to each knowledge gap, and so forth. And we think that's a really helpful resource for the future to be able to pinpoint which knowledge gaps are not being addressed by anyone or has not received any funding, and maybe it should. So next slide, please. And then the final question, and that's actually my final slide, is it's not the solution, but it's just a thought-provoking idea, is that instead of developing a risk evaluation framework to begin with and then ask the researchers to pitch in with data, I think we're trying to take the opposite approach and saying like, okay, what is the information that we'll get from all the different work packages, and how can we actually display that information in a meaningful way? And at the moment, we're looking into these spider web diagrams where we're simply trying to say, like, for instance, for carcinogenicity, like what is it that the researchers in PlasticHeal are generating of data within this endpoint, and how could we display that meaningfully in a way where you can also display all the kinds of information simultaneously, so that we just don't have one piece of information, but we're actually able to communicate the full picture of what we know about the human health risk assessments of nano and microplastics. And I think that was my final slide. If you're interested in discussing this further with me, of course, I'm happy to take questions in the Q&A, but also in the future.
Great.
Yes.
Thanks so much, Stefan. Perfectly on time and very thought-provoking indeed. So instead of taking Todd's approach, saying this is what we need to do risk assessment, say, okay, this is what we've got. Let's work with that. I like that. That's an interesting proposal. So now next, we are looking forward to hearing from Larissa, who will speak on behalf of Aurora. Larissa is the co-coordinator actually of this project. She has a background PhD in epidemiology and she's currently assistant professor at the Julius Center for Health Science and Primary Care at the University Medical Center at Utrecht, and also affiliated with Utrecht University. And in her research, she investigates how chemical pollution and more broadly, how the exposome affects child development and contribute to disease susceptibility later in life, including the mediating effects of the gut microbiome, which is a fascinating topic in itself and very complex. And Larissa, I hope you are here. Would you unmute yourself? There you are. Over to you, please.
Hi, thank you, Jane, for the warm welcome. Nice to see you all and so many people online. I've enjoyed the morning presentations very much, discussions. So I'm going to talk about Aurora. I'm glad to see that reproductive toxicity was flagged as being addressed within CUSP, and I'm going to tell you some of the ways that we are going to advance the exposure assessment techniques that we need in this field, and some of the reproductive toxicity assays we're doing. So next slide, please. So the Aurora project, we're focusing on this vulnerable or sensitive period of exposure, early life, and when the placenta, the temporary organ, appears and disappears, and how that potential exposure and toxicity affect the health of the mother, maternal health, and the health of the developing fetus and early life development. And we're focusing on, we've investing a lot of effort in this project on advancing analytical methods for measuring mass-based exposure assessment of micronanoplastics, and also nano-range nanoplastics, the smaller end of the scale. And ultimately, we will work to integrate all this information and to indicate to policymakers in our community, a broader community, what is still needed to do risk assessment with a focus on early life hazard assessment. Next slide, please. So with respect to advancing exposure assessment, we're taking two approaches. One is to develop methods for population biomonitoring. So this is led by my colleagues at Emory University and Maastricht University, Douglas Walker, among others. And we're looking at mass-based, I'll show some preliminary results on the next slide, but mass-based approaches to exposure assessment, combining pyrolysis, GCMS, with non-targeted chemical profiling. And then the other approach is to more zoom in and see if we can characterize particles, individual particles, and measure the chemical composition and the size and the other characteristics of these small particles in tissue. We're focusing on placental tissue. We're also measuring in blood, cord blood, to develop more broad population biomonitoring approaches. Next slide, please. So on the right, we have some unpublished results, early results from my colleagues at Emory University. Anna Roebuck, who's now at the US EPA, and Douglas Walker, formerly of Mount Sinai and now Emory University. And they these are the first mass-based assessments, or these are real placentas. These are not spiked. These are placentas that we have from women in our birth cohorts. And these are the levels of, these early results of levels of micronanoplastics. Others have, in the past year and two, detected micronanoplastics using visual microscopy techniques. And this is, again, the first mass-based measurements, which we're excited about. And then on the left, this is work by my colleagues in Utrecht University, Lara Soutendijk, Lawrence Mandemaker, and Florian Meyer. And they are using various techniques, including PIFM, or photo-induced force microscopy. This is a scanning probe microscopy, but these microscopy visual techniques combined with spectroscopy, where they can really zoom in and look at the very, very, very small particles, and also the chemical composition, the chemical characterization of these particles. And important, a lot of effort has been gone into tissue digestion protocols. How do we do this in a reliable way? So I think this has been addressed by multiple speakers, also some of the challenges of working with these micronanoplastics. Next slide, please. To address the hazard assessment, we are using a variety of toxicological assays, starting from more our tier 1 or simpler monoculture, so single layer models that are addressing the important single layers within the placenta to multi-layered all the way to a placental perfusion. And that's where you take a fresh placenta and hook it up to a machine essentially and pump blood and or mimicking blood through it. So what we are doing here, we will look at uptake and transport in placental layers, and also how it affects the placental function and integrity, including endocrine function and other immune responses. The next slide, please. So these are some early results, also in preparation still, but led by my colleagues at Utrecht University, Vrije Universiteit Amsterdam, and the University of Eastern Finland. But on the left, we see this is we created this micro nanoplastic with a dye, a PDI dye, and here you see that these micro nanoplastics in green are being uptaken into the cells by my colleague Hanna Dusa of Utrecht University. We see also that different size ranges is being transported across this BWO monolayer, but that's this important cell layer in the placenta at the interface of the fetus and maternal. And then these different sizes affecting barrier integrity. And I won't go into detail, but there's a nice publication in EHP recently by Hanna Dusa. The next slide, please. And then to assess associations in humans in observational settings in epidemiology, we are working on 2 birth cohorts where we have placental and cord blood samples and a rich set of health outcome data. And this is work that will come. So I don't have any preliminary results to show yet, but we will look at a variety of outcomes reflecting placental function and also development, early life development in the children in these birth cohorts, in birth cohort in Spain and Barcelona. And then we have a new cohort which we're setting up and recruiting now for women in the Netherlands, where we would do a comprehensive assessment of household determinants, dietary factors, food packaging, food preparation methods, and assess micro nanoplastics in household dust and internal biological samples for the characterized determinants of micro nanoplastic exposure. Next slide, please. And then for our work with risk assessment, this is being led by Matthew Boyles at IOM, Institute of Occupational Medicine, and colleagues there. And what they have done is to do a systematic evidence mapping to check the adequacy of available regulatory risk assessment tools. We've heard already that it's a very complex micro nanoplastics problem, and some regulatory tools cover aspects of it, but they're not fit for purpose yet. And what we will do is update this at the end of our project and come up with a roadmap for how we can achieve risk assessment, what would be needed still, what gaps are still remaining at the end of our 5-year project, also considering all the work that's coming from our CUSP colleagues. So with that, I'd like to have one more slide, and I just want to acknowledge all the colleagues who are working on this, including Jane and Professor Rolf Vermeulen from Utrecht University and UMC Utrecht, who is coordinating this project. Thank you.
Thank you very much, Ravissa. Very interesting, and yeah, really good to hear where you are at this point in time in regards to Aurora. Our next speaker is Rudolf Reuter, who is co-coordinator of the project PlasticHeal. He has a PhD in geochemistry, and he is an expert in the field of laboratory test systems to study the biogeological behavior and fate of industrial chemicals in relation to regulatory needs. Rudolf, are you ready to introduce the PlasticHeal project?
Yeah, thank you, Stefan, and thank you all behind PlasticHeal, to Jane and others who made this meeting possible, which I think is a very good opportunity for all of us in CUSP to interact with stakeholders and others outside in research. So I prepared some slides together with Dana Kühnel, as you can see, and Leslie Tobin from the PlasticHeal project, in order to show how we can contribute to these knowledge gaps that we still face when it comes to more regulatory-based risk assessment and regulation. Next slide, please. PlasticHeal, as you can see, is a large consortium, which is not so easy to handle on the one side. On the other side, we have the advantage that we have involved a lot of research laboratories and can, so to say, have the ability by this to have to compare different methods in testing, characterizing different micro nanoparticles. Next slide. This gives an overview of our work plan, which makes clear how we will address the risk assessment and management by having a work package 1, that deals with more basic characterization of selected representative test materials in order to find the methods that are applicable, that are suitable for quantifying, detecting, identifying micro nanoparticles in different matrices, and also by this also in tissues, human tissues, which is another main focus, of course, in PlasticHeal as a basis for human hazard assessment. All these data and methodology will flow into work package 4, which is focusing on risk assessment and management, because our foundation in PlasticHeal is that only robust and validated methods can produce the reliable data and knowledge we need to implement regulation. Next slide, please. So I just will highlight the different activities in the different work packages. Work package 1, as you have seen from the work plan, is mainly dealing with to create a repository for the test materials we will use. And so far we have developed a first and a second set of micro nanoplastic particles with different sizes, shapes, and compositions. Altogether, so far, 18 test materials. In this work package, we try to find good methods that allow us a good characterization of the materials we are using for tests later on. And also another very strong focus in this work package is to find a way to disperse the materials that will be used in the different tests by using different synthetic and natural surfactants, and also to simulate different exposure scenarios within the human body. And so also this will be another main focus, as mentioned before, is to validate the methodology we develop, and this will be done both on the CUSP level, but also within PlasticHeal, and so by this contribute to standardization and method harmonization. Next slide. This just gives an idea of, or an overview, a list of the test materials we have developed and which we have provided within the project, but also beyond. Next slide. Work package 2 is focusing on the assessment of main exposure sources, levels, and routes of micro nanoplastics in the human body. And there, of course, by air, through the lung, and food, water, gut, and personal care products when it comes to dermal exposure. This figure is just illustrating these main exposure routes, and also the compartments within the human body we are looking closer to. Next slide. so far we are doing a screening of exposure levels in food and drinking water, which will come from several European countries, and also looking to the fate of the micronanoplastic particles in the gastrointestinal tract. And by using rather novel models, a static and a dynamic model. And we also, of course, will look into the fate of these particles in human tissues, which we have obtained from different medical programs, also to see if and how these particles translocate from the primarily exposed organs into surrounding tissues and secondary organs. This will be, of course, completed by a follow-up of the excretion, the release of these particles by using samples of feces and urine. We also do a lot of air sampling in different working environments, also by using different air sampling devices. And also we are adapting previous fate models and also PBPK and compartment models to determine fate and effects of particles entering the human body by ingestion and inhalation. And also when it comes to personal care products, we are also trying to find out which are the main exposure routes, dermal, by different products and or ingestion and inhalation. So this is also another focus of work package 2, exposure assessment. Next slide. So this figure illustrates the test materials we are using and the target systems in order to assess the human health effects of micronanoplastic particles. And as you can see on the left, we have started with more or less pristine particles test materials, but now in the second period, we will go slowly over to also look closer to what happens with particles that have adsorbed contaminants, and also with particles where additives leak. That means we are looking more to real test materials. Next slide. Yeah, so far we have done studies on acute effects on cell viability, membrane integrity, on the immune system, and first results indicate that no significant effects so far, except for immune effects where we can see that there is a dose-dependent release of biomarkers. Next slide.
You only have a couple of minutes left.
Okay, thanks. So this is work package 4 on risk assessment, and this we can go to the next slide where I just want to show the main tools we will develop within as one requirement for the risk assessment strategy. The one is a web-based platform for stakeholders that will integrate all the results we have achieved and inform all the users on up-to-date relevant guidelines, regulations and recommendations, but also to run own risk analysis by employing the PMCDS or other specific tools that have been developed in Plastics Fate. And another main tool is just this prospective criteria decision support system, which can be used for early risk assessment of plastic applications and is screening different prospective indicators and considers polymers, additives, and the fate of the plastics. And as you can see on the right side on the box, this gives you an indication how this may be used later on. It gives us an estimate and a comparison of risk of different plastic materials produced at an early stage. And on the very right corner of this box, you can see that. So, for example, we will be able to group different plastic materials according to their risks. So, on the left the pink dot would pose materials would pose lower risk, and materials represented by the blue dot would pose higher risk. So it would be rather easy to see where possible action, mitigation or reduction, risk control and management actions should be taken. I think that was the last slide. I have one slide more for the next slide. The case studies we will also do, which include also human biomonitoring studies, and also studies to see how these plastic particles, their surfaces could act as vectors for pathogens, but also we will look into long-term exposure of micro nanoplastic contaminated food. That was the last slide. Thanks.
Wonderful. Thank you so much, Rudolf. And also we will get to questions to you after we've gone through all the projects. So thanks, Rudolf. And I'd like to invite Tanya, who is our next speaker, and she is the coordinator of ImpTox. Tanya Cirkovic-Veličković, I hope I pronounced her name properly, Tanya. We
yeah,
go by
that's
first
fine.
name.
Perfect. Perfect.
Good. I'm fluent in Serbian. She, as I said, is coordinating the ImpTox project. She's a full professor of biochemistry at the University of Belgrade. She has many accolades, and we don't have time, unfortunately, to go through all of those, but she's a very high-profile, successful researcher. And she's also an expert on immunology, and the special focus of her work is on food allergens. And what I find really interesting is on the impacts of food processing on protein structure in foods. And Tanya, you will tell us more about ImpTox and risk assessment.
Thank you, Jane, for the very nice introduction. Good to see you all, and I have enjoyed all the presentations given today. Gave us a very good insight into where we stand when it comes to the risk assessment. ImpTox is a project that has its own strategy and approach when it comes to the risk assessment. As we have already mentioned so many times today, a big issue when examining of risk and hazards and exposure with micronanoplastics is the lack of methodology, analytical methodology for very small particles. Also, we are dealing with, chemically speaking, extremely complex material. And it is definitely not easy to make a good approach, a comprehensive one. That's why in ImpTox we decided to go for a little bit more focused approach. Next slide, please. And in the ImpTox, we would like to understand the very complex role of micronanoplastics in combination with the environmental contaminants on human health, with a special focus on allergy and asthma. Next slide, please. We are going to conduct a few exposure studies that are both relevant for the respiratory inhalation route of exposure and ingestion route of exposure. And these exposure studies are also related to the main contaminant, environmental contaminant and food contaminant that we are looking at. These are the allergens. So the exposure to microplastics from seafood is relevant for major allergens that are found in different seafood species. Also, when it comes to the exposure to micro nanoplastics from sea spray aerosols, we would also like to relay these data to the respiratory allergens, such as pollen allergens that can be found as co-exposing contaminant to the micro nanoplastics. And we also want to include one human exposure study and biomonitoring studies with the special focus on the vulnerable population, the pediatric population that is more prone to allergies, especially food allergies, than adults, and that might be even more exposed to microplastics than the adults. As for the hazard assessment, we also made a focused approach. We would like to focus on only two chemically different types of polymer materials that we are going to manufacture. include in all our in vitro and in vivo models of the different hazard that we want to look at. So we will focus on the PET, polyethylene, which is a high density material, and also the polypropylene, a low density material. And we also cover different sizes, the size range of microplastics and short microplastics, like around or less than 10 microns, and nanoplastics, especially for the respiratory route relevant co-exposure studies in our models for respiratory allergens. And next slide, please. For the exposure studies to micro nanoplastics and allergens, we will also look at the co-exposure. And to do so, we planned to collect from 3 different markets. 2 of them are in Europe, and one is in Asia, in fact, in South Korea, Far East. So from 3 different markets, we will collect seafoods, having in focus shrimps and mollusks, 2 species that are mostly consumed on mussels, of course, and clams. And in one lab, using our developed protocol for extraction and characterization by micro-FTIR, we are going to look at the microplastic content in those collections of seafoods. In parallel, we will also develop methods and monitor and quantify the major allergen content, that's tropomyosin. While in Europe, we have 14 allergens that we look at, and mollusks and crustaceans are among them. We'll also talk a little bit effects of processing on the levels of microplastics and major allergens in these samples. It will help us provide the exposure and co-exposure report on the microplastics and allergens in a well-defined collection of samples from different markets and different regions. Next slide, please. So this is just a very brief overview where we stand for now. We have so far analyzed the parts of the collection coming from Belgium, from Croatia, and we have already can see some differences in the types of microplastics found and also in the quantities. Next slide, please. When it comes to the in vitro work, in which we look at certain hazards that are related to the interplay of micro nanoplastics and the contaminants such as allergens at the first responder lines, we will set up the models that are suitable for, let's say, food allergies as well as respiratory allergies. We will, of course, have in focus primary immune cells and in-house produce micro and nanoplastics in ImTox. So these are just the very first results observed with small microplastics based on PP, polypropylene. And for now, we don't see any relevant toxicity or viability effects on primary cells, as well as the effects on the important maturation activation status of monocyte-derived dendritic cells. Next slide, please. We are also conducting studies on the cells that are also relevant for immune systems, such as COCO2 cells. And in our setups, we also would like to use the subtoxic doses to monitor the energetic status. In some of the pilot studies, we have observed effects on the bioenergetic status. These studies will be also conducted in combination with different contaminants frequently found in food, such as cyanotoxins. Next slide, please. For the effects in the gastrointestinal tract, these effects are particularly relevant for food allergens because many of them are resistant to pepsin digestion if they are going to sensitize patients through the oral route. They're again, once taken up by the bodies in the cells, processed in the endolysosome compartments to to generate peptides that will be presented to the immune system. That's why we have a work package in which we look at the molecular effects of these potential interactions of allergens and different microplastics produced, as well as nanoplastics, and also at the effects of the microplastics on the enzymatic activity. Then we again combine these in assays in which, in simulated conditions, we look at the protein digestibility in different paths, also at the protein structural and functional properties in the case of microplastics presence, or in the case of the binding. And we indeed have already observed that in certain conditions, especially in soft corona proteins, we can see the slight conformational changes that may also affect some functional properties. It is, of course, very important to stress that the conditions included must be exposure relevant. So we need also to relate our in vitro testing to the exposure data, such as daily intake of microplastics, and set up appropriate experimental conditions, so not to get like the data that are outside of the ranges found in, let's say, normal diet.
You're running out of time a little bit.
Yes, yeah, you can go for the next slide.
Yeah.
And of course, we will be doing a clinical study. In this study, we are going to recruit a population of allergic and healthy children. Next slide, please. In the clinical study, we would like to assess the level of exposure to microplastics in food and water. And next slide, please. Our population will be recruited from 3 different, geographically different regions in Croatia, from the area near the sea, by the sea, and also in the urban and rural area. Next slide, please. For the exposure assessment of the oral route, the children will be given a detailed nutritional questionnaire. We will take up blood and assess the allergic sensitization. Next slide, please. The sampling will be done for the presence of microplastics. In the stool samples, we can work with the analysis of the microplastics using the extraction and micro-FTI characterization, while the microplastic will also be analyzed in the induced sputum and exhaled breath condensate. We will be also monitoring several markers, co-stimulatory markers expression in blood samples. And finally, the allergy status, the inflammatory markers, and exposure data will be correlated at the end of this. Next slide, please. I think that was all. I hope I was on time. Thank you.
Yes, thank you very much for your attention. Yeah, I don't think you were quite on time, but that's perfectly okay. We're in good time, so that's perfect. So the final speaker to introduce the various projects is Raymond Peters, and he's here to present PoliRisk, which he coordinates. He has a PhD in molecular biology and is a professor in innovative testing in life sciences and chemistry. He's an associate professor at the Institute for Risk Assessment Sciences at Utrecht University. And with that, please, the floor is yours, Raymond.
Thank you, Stefan, and also Jane. Thank you for organizing this this great meeting. I'd like to briefly introduce PoliRisk, and you will see in my slides that we all the CUSP projects more or less face the same gaps. We, as others, are interested in understanding the effects of microplastics, micro and nanoplastics on our health in particular. And as you know, we need to know more about exposure and about the hazards of these contaminants. Next slide, please. So our overall aim is indeed to get the risk assessment strategy, and we will collect data in our project on exposure, but also how to measure exposure, which is a great challenge. And we also like to develop methodologies to determine the hazard. And together that should give information and tiered approaches to get into a risk assessment strategy. And therefore, we will, of course, use an integrated approach to testing and assessment. So next slide, please, Stefan. Here are the sub-objectives, and you see immediately with these objectives where our challenges are. So we like to assess exposure and the biological effects. And our aim is to do that in real life scenarios. I will show them in a minute. But with that, to assess exposure, we need to innovate sampling methods. We are working on the job, more or less. It's on the run. There's no clear sampling methods, so that's a challenge in itself. So we do the real life studies at the moment, and also discover how we should sample, how we should analyze the samples, how we can assess effects in human blood. And I like to stress here that we focus in Polyrisk on immunotoxicity, which has an advantage because we know a lot about immunotoxicity by nanoparticles. So we have methods available, but still working with MNPs is different than with nanoparticles, as you can imagine. So we're working towards a sort of tiered approach with in vitro methods, human-based. And with that, so our real life knowledge on real life scenarios, sampling methods, and in vitro assays, we hope that we can come to a risk assessment approach, combining all these information. And in the end, hopefully we can do some preliminary risk assessment with MNPs. So next slide, please, Stefan. So here's just to show how everything is linked. So we have these real world human scenarios where we will test exposure and also characterize the exposure. We will also look at the immune effects, and the advantage, of course, is that in blood you can relatively easily assess immunological changes. At the same time, we will work on these hazard methods, so in vitro methods, to complete our in vivo work. And together with all we learn about the analysis and characterization of MNPs will feed into a work package where we work on human risk assessment. And that will include, of course, AOPs and YATAs. So next slide, please, Stefan, is to show you what we do in the work package with the human scenario. So we have selected 5 scenarios. One in traffic related, one drink water related, one textile industry linked, and one in Norway indoor soccer field, so with artificial fields. And we are working on the last scenario will be probably in the tire rubber factory. So 3 of these scenarios are either they are completed in the field study, that's the soccer study. We still work on the traffic scenario study, that's halfway, and the textile scenario study will start in this half year, and drinking water probably later this year. So next slide shows you what we do now with the sampling and method development, analytical method development. So we have tools to analyze at least polymers that are derived from particles in blood. So we have, with the VU Amsterdam, we have a method to analyze these particles in blood with pyrolysis GCMS. We can also work actually on analysis of air samples, which is not a simple thing. It starts with the right filter selection and collecting enough air to get enough particles on your filters. That's already a challenge in itself. And the liquid sample filtration to do the water analysis also not an easy one. You see here the filter setup that is developed by Fraunhofer Institute. So we have that now in place, and I think we are up to the analysis that we need to do. So the next slide shows you what we do in work package with in vitro testing. So we, as mentioned, we envision a tiered approach of in vitro testing. We will use cell lines, human-derived cells, we work in organoids and skin models and air-liquid interface, but all to assess effects of MNPs on macrophages, on epithelial cells that will release all kinds of inflammatory factors. And we also work on dendritic cell activation and T cells. And recently we showed that polystyrene, as an example, can stimulate dendritic cells and T cells, but only if it's contaminated with LPS, endotoxin from bacteria. So that also illustrates the importance of the complexity of the particles, but also the importance of the weathering effects of particles. So the next slide is on the work package 4, and that is work in progress. And the next CUSP meeting, we will address this in more detail, but what we work on now is a risk assessment approach, the framework of that. And we will include, of course, exposure routes. It's clear that in polyrisk, the focus is on inhalation, but we also will consider oral routes, and other CUSP projects maybe are more oriented on oral routes. So we will gather that information anyway. Of course, we will consider the chemical and physical characteristics of the MNPs. Think about size, shape, but also surface chemistry. Also, the vector or the microbial contamination will be included. And then, of course, a lot of the risk assessment will be also dependent on the solubility and the amount of toxicity of the MNPs. And as mentioned, we will focus on immunotoxicity as a start. We foresee that in the end, we will have a sort of grouping approach and may have to be distinguished between fibers, particles of polymers of low concern, and maybe specific MNP toxicities, but that's all work in progress. And Andrea Haase, who is also in the audience here from BFR, she leads this work package. And the next slide, please, Stefan. She and Polyrisk will organize the next meeting, the CUSP meeting, which will be on March 14. You are all welcome. You will get an invite soon. And that will be on the risk assessment frameworks. And hopefully we can do that in a joint activity with all the CUSP partners and with help of you, of course. So that's my last slide. Oh, and one more, that's to acknowledge all our partners. Please change that. And these are the partners also from all over Europe. And I leave it with that. Thank you.
Wonderful. Thank you, Raymond.
Yes. Thank you very much, Raymond. We haven't received that many questions in the chat, but the floor is actually open now for questions and comments if you have any. I would actually like to kick off this Q&A session with asking the questions to all the CUSP presenters of whether you believe that we're actually addressing the regulatory gaps that we heard about this morning through the work that we have planned and that we've all presented this afternoon. What is your impression? Are we on track, or are we actually providing answers to questions that the regulators never posed? Or what do you think? Yes, Raymond, you have please.
Unmute. Well, I think what I realized after starting Polyrisk and also listening to all the CUSP partners that we still have a long way to go. But I believe.
Oh, you're breaking up a little bit,
with
right?
what we do, and it's we do. And I think we all face or all work on.
Could you just repeat the last sentence, Raymond? Because you broke up, I think, in the beginning of the sentence. So
I think within CUSP that we all address the most important issues. That is how to analyze these particles in real samples, so not as pure commercial available particles. That is maybe relatively easy. So we do that. We all work on exposure. We all work on hazards, and we all work on sort of real world scenarios. So in the end, I think we will have a lot of information that from that time on, so in 4 years time, we will be ready to do the real work, I believe. And that has in particular to do with the analysis. The analysis is very difficult.
Any other comments?
Yeah.
Or
I just can support what Raymond was saying. I think we will not end up with a pattern solution at the end of the 4 years, but I think we will, of course, meet a lot of these knowledge gaps we have faced so far, and of course we will create new knowledge gaps. But the complexity of the issue we are dealing, and I think this is very well illustrated today by this workshop, is demanding and also in a way forcing us to focus on those gaps we are aware now and that really affect. As was also said in the morning, a high share of the population or vulnerable groups. And I think another main aspect is, of course, the methodology that we need in order to really make a step change in our understanding of the fate and effects of micro nanoplastics in humans.
Thanks, Rudolf. What about the others?
yes.
Marissa?
Alba, yeah, you must have an opinion on this, Alba.
You're putting me there on the spot.
Exactly.
Well, yeah, I kind of think that we are on track. We have made a good job in identifying in advance what are all these gaps. And although we don't have, for instance, in PlasticHeal, a clear idea yet of what will be the framework that we are developing, we have paid attention from the very beginning to regulatory aspects and guidance, etc. So I kind of think that we are on track, although it's not possible that we tackle all the different questions. For sure, each one of the different projects will probably highlight one or two of these questions. So at a global scale, as the cluster, I think that we have good chances to answer many of those, not completely, but at least to provide information to move on.
Maybe if I could just offer a quick reflection. I'm sensing from some of the comments in the chat also that there's some frustration that it sounds like the science needs many more years to reach. We can't promise at the end of cluster that we will have all sorts of definitive answers. We need a lot more scientific developments, and then there's frustration that from a precautionary perspective that perhaps we should be addressing micro nanoplastics from a regulatory perspective before the science is definitive. And I see that tension, and I wonder if I think some of our colleagues in the risk assessment world from IIM also and others have promoted probabilistic approaches where we're dealing with these big uncertainties and still trying to do our best to come up with a risk assessment responses, hazard assessment and risk characterization using probabilistic approaches. So I think I think this sort of forum is very helpful that we can hear from both perspectives that we need those fundamental scientific developments, but we also need to perhaps address it before we're comfortable with the level of scientific advancements.
Tanya, do you also want to provide input here, or will you
You're
wait
muted.
for the next question? Or,
Yeah, I have seen some questions in the chat that I have already provided answers.
Yeah,
it's really intriguing.
that's
The hypothesis of our project was that micro nanoplastics can be vectors or allergens. Maybe this tight binding of that kind of proteins to the hydrophobic surfaces might protect them from the degradation in the tract and further promote the allergies. That's why we put a lot of efforts into planning this line of evidence that can actually be in support of the hypothesis. Eventually, at the end of the project, we might have solid evidence for one particular condition, such as allergy and asthma, when it comes from the food and also respiratory route. Of course, it is not possible to give answers to all the open questions. It's huge, huge, huge field. But if from all 5 projects, there come like not solid evidence that there are health effects, maybe there are no health effects of nanoplastics at the levels we are exposed at normally.
But I do think it's interesting that a couple of first results have shown impacts on some part of the immune system. And there was a comment in the chat from Esther Kendon at Leiden University who basically asked the question, you know, maybe the risk assessment and regulatory frameworks that we have in place right now are not, you know, focused around this challenge of micro nanoplastics. And excuse me, maybe, oh, I'm sorry. Maybe that's also some food for thought for our colleagues at the Commission to think about, you know, whether this potential vulnerability of the immune system is sufficiently addressed with the current regulatory framework.
Yeah, that can be for sure true. In fact, we need to be very careful when we, you know, how we interpret our results. Because when we look at the exposure data, first of all, we don't have the exposure data for nanoplastics. And for even for microplastics, the data come from studies that are not so well standardized. We have here in a lot of presentations today, there is a lot of gaps. So we are setting up some ranges in which we test and we observe some effects or no, or we don't observe. But for instance, yeah, hopefully with more reliable exposure data, we will also be able to set up questions that can be answered in a solid scientific manner.
I see that Todd has raised his hand, so please, Todd, feel free to.
Yes, thank you. I guess I had a question and just sort of reflecting a lot on number of decades of research in particle toxicology that's taken place. And I know Raymond mentioned sort of adapting some of the learnings from the engineered nanomaterials space. But one of the things I guess I didn't hear a lot from the CUSP researchers was the use of other types of particles as sort of benchmark materials, either as negative or positive controls to help provide some context to the results that are being produced. So one of the questions that I always have is whether or not the plastic that we're being exposed to, these microplastic particles, nanoplastic, have something that's intrinsic about them, or are the effects actually potentially consistent with other types of particles, and how can we perhaps consider the development of read-across approaches whereby we don't necessarily have to reinvent the wheel. We can hopefully build on what other research has been done. And again, let's appreciate that there are decades of research on particle toxicology that's taken place. So I'm just curious to know if there's direction headed in that sort of area within the cluster.
Raymond, go ahead.
Yeah, Todd, a very important point you make there. And that's also what we face, for instance, in the traffic related scenario, where the exposure will be a mixture of diesel exhaust or exhaust particles, and also rubber and tire wear and brake wear. So probably in those cases, you already see that there's a great variety in how we are exposed. Of course, we can learn from particle toxicity, but what I now learn is that the microplastics are far more complex. And maybe I'm wrong at that, but it seems to be far more complex than the other particles. It's not only all the chemicals that may adhere to it, it's the plasticizers, it's all the material in the plastics, and they may also serve, as we have heard, as a vector of food allergens or microbes, or so that makes it a new dimension. And as said, we don't see much, and I saw also for PlasticHeal, we don't see much with naked or virgin particles. The effects become more apparent if we look at the complexity and look at weathered particles. So it is an additional challenge, I would say. But of course, we can learn from particle toxicity, and that's for sure.
Yep. So we're going to take some more questions. See, that led to a number of hands being raised. I'm just going to share a poll while we, or launch a poll while we take the next couple of questions or comments. So Henrik B.H. Pedersen, would you like to unmute and maybe also open your camera?
And
I'm not sure whether, can you hear me now?
Yes, now we can hear you. Hi.
Okay. Thanks a lot for all of the presentations here. Really interested in this whole package of science that you're producing. I'm representing Plastic Change, and I followed this issue for years. And one of the studies that really got me interested was the study about the lining of single-use beverage cups and the release of trillions of nanoparticles into, for example, hot coffee or hot tea. If this is for real, I mean, it's populations exposed every day to trillions of nanoparticles. Is that something that you have considered in an exposure scenario?
Maybe, I don't know, Marissa, Tanya, your projects are doing food studies.
I can also answer.
So go ahead, Alba, go ahead, yeah.
Yeah, no, it just in PlasticHeal it's not that it's the main thing, but we are trying to explore whether we can find micro and nanoplastics, actually, because we are highly focused on the nano size, since we believe those are the most relevant in terms of health. The nanoplastics that are released from tea bags. And this is something that we are exploring, and we are conducting hazard assessment using different models of the gastrointestinal tract. So it's not exactly the cup, but a realistic, let's say, a scenario that somebody will be exposed to this micro nanoplastic daily.
Thanks, Ivan. Let's move on. Hendrik, thanks so much for your question. We have Esther Kentin who would like to also ask a question. Esther, do you want to unmute yourself, turn on your video? Oh, we can't hear you, Esther. I'm not sure if your microphone needs to come down. No, we still can't hear you. I'm sorry. So maybe as you figure that out, Birgit's also wanting to come in. Sorry, Esther.
Yeah, hello. I do not manage to start my video, but most probably
now we can see you. We can see you
there. So yeah, thank you very much for your feedback. How the different projects will address the knowledge gaps and the regulatory needs. I'm sure at the end of the 4 or 5 years of research, we will know more about micro and nanoplastic, and we will have closed, at least partly, some knowledge gaps. I'm also sure that not all answers will be there, and there might be reasons to continue. Having said, I think what is also good that all the projects for different reasons work on analytical methods, because we saw that analytical methods are really important on one hand to get a grip on the real exposure via the environment, via the food, and so on. And on the other hand, also, to verify what you are doing in hazard studies. So this is very important, and that is also important for EU policy. So having said in the beginning, yes, CUSP will address knowledge gaps, but surely will not be able to close all knowledge gaps. I'm very happy that we started to have prevention, reduction, mitigation measures in the legislation, like in REACH and the upcoming policy options for the reduction of unintentional release of microplastic. Just to go ahead with the reduction of microplastic, even if we have not a full understanding of the entire toxicity. Then I would have a comment concerning the additives and other chemicals which are related or part of a microplastic particle. I think if we have good evidence, proof that certain plasticizers, additives, whatever it is, are dangerous and pose a risk, we can go and regulate those as chemicals under the REACH regulation. So I think that for me would be the most straightforward approach if we are aware and if we have evidence of the risk of a certain chemicals. Yeah. Thanks a lot.
Birgit. Yeah, and now I'm going to ask the question that I've been trying not to ask to our colleagues at EFSA. We're very curious to know when the BPA risk assessment, or scientific opinion, I should say, will be published, because that is one of those hazardous chemicals in plastic, and that's been a battle for many years. So I don't know, Jean, I don't want to put you on the spot. You can also decline to answer, but any news on that?
To be honest, I don't know.
Okay.
Maybe my colleagues who are still on, let's say, online, they can provide an answer, because I know that it's in the final stages, but it's a delicate topic, as you know, as you all know.
Yes, and the only reason I ask is because it was announced by EFSA that it would be published before Christmas last year, not this year. So that's why. Okay, well then the suspense continues. Yeah. Thanks a lot, Birgit, for those two very, very important comments. Okay, Stefan, I think we have to wrap up, huh? You are muted.
Yes, I agree with you that we have to wrap up. So I just launched a poll that it's going to be interesting to follow up on. I would like to thank you all very much for your participation this afternoon. And I think it was very thought-provoking, and it was really good to see both from the regulatory side what they want us to provide, so to speak. It was also really nice to have a discussion with all the CUSP coordinators and so forth about the answers that we might provide. And I think it's a really good starting point for future work and trying to match these two needs and haves, so to speak. As we've mentioned a few times earlier, this is the first of a series of workshops that we're having within CUSP. The first workshop was focused on understanding regulatory needs and also trying to understand what kind of answers are we providing. The second workshop that Raymond also introduced a little bit is organized by PolyRisk, and that's going to focus on risk assessment frameworks that are being developed within the different CUSP projects and also elsewhere, trying to understand what are the key components of these frameworks and what kind of information requirements or what kind of data requirements are there in order for those to be applicable and so forth. And then the final workshop on the 21st of April will be organized by Plastic Fate, and will focus very much into how to address the data and information gaps that there are before we can apply the different risk assessment frameworks. So it's in our perception, is a very nice series of workshops that kind of bring everything together. So we hope that you will also find this interesting and that you'll be participating, and that we'll see you next month.
Great. Yeah. Maybe just to add, if you feel like it, we invite you to share 1 or 2 words of conclusion in the chat. I think it was a terrific workshop. Thanks for sticking with us. Wasn't a short workshop, but I think we got a lot of ground covered and a lot of information. Thanks for all the questions and comments. And we will make the recording available on the CUSP website. You can sign up to our newsletter, and then we will definitely make sure that you get the information on the other 2 workshops that Stefan mentioned. And yeah, keep in touch with us. Please send us an email, share your comments also on the CUSP website. And yeah, with that, I think we would like to thank you all, especially to the presenters, for making our job so easy. And we have work to do, Stefan, huh?
We do, absolutely. Yes.
Okay, take care.
Thank you very much.
See you in March.
Thank you. Thank you.